And we're live. Hello.
Hello.
We'll give it a few minutes for people to drop in and get the notification.
Chit chat and let people show up.
Yeah. It usually takes them a few minutes. But I miss so much stuff not getting notifications.
You don't get notifications?
I do, but if I'm not like actively on my phone.
Yeah, I understand. Then they don't necessarily come through.
Yeah, but if I'm watching TV, what's nice is I have this Samsung computer and I finally got it all set up and it's linked to my phone. So I get a nice big square notification now. So I've gotten some more notifications in the last few days than I normally do. So,
my notifications pop up. I mean, it just told me you're live. I just don't always see them. Hey, Eric.
I probably got a notification too. But see, on my phone, what I get, the problem is I have it as a little dot, and all the notifications are under there. So I have to open it up.
So you have to open the dot and see who.
And if I'm busy, I'm like, go away, and I don't look at it. Hey, Eric. Hello. I'm surprised you're up. No, it's later than usual. Man, I was up late last night. Because I never go right to sleep afterwards. I'm too wired.
Yeah.
How's the weather in California? We're still kind of chilly here, but not freezing anymore.
In California?
Yeah, he's in Culver City.
Oh, Eric's in Culver.
You're close to there. You're on that side of the United States.
I am on that side of the United States. It has been rainy and windy and relatively warm in the 50s. What, Kim?
67 today. I didn't know.
That's awfully nice.
Warm. Yeah, we had to run our water for like 4 days. 70s.
Orion.
That's nice.
Orion's being a pill, so we're going to bring him up here and see if he wants to.
Okay. Well, I'm glad.
And behave a little more.
Hi there, puppy dog. Hey, Buttercup. Yay!
Oh, my goodness.
Hi, Buttercup.
Hi, Buttercup.
Oh, you're so pretty.
Stop.
Now, is that
Orion
the one that
was a mama's boy?
Not feeling good there for a while?
Yeah, he had... So dachshunds can get a thing where the synovial sac, I think it's synovial sac, the cushiony thing in their spine, spurts out and their nerves get pinched in there.
Yeah, I know. I didn't want a dog,
and it like paralyzes them. Yeah.
And to come to find out, so I picked her. She was born here, Petunia, and she looked like a normal little puppy. Well, now she's long, so there's definitely dachshund in her somewhere. So she's got a lot. I really watch her. I'm getting
I can't let him jump off of anything. Or at least I try not to.
She does. She will jump off the porch.
Oh, he looks like a Muppet, like Grover, right? You know, Super Grover.
Oh my goodness.
He'll jump off of anything and he looks just like Super Grover. It's the most adorable thing you'd ever seen, but that's what puts the pressure on their backs that causes the injury.
Well, the vet already checked her and she has a problem with one of her knees. He said that one of her back legs. So I'm going to get some training treats here, and because we have steps up to the bed. She knows to go down them, but she'll jump off anyway.
It's not the getting up that's the problem. They'll take the step. He'll take the steps up. He'll jump down any which way. So I keep him in a harness tied to the center of the bed in bed at night, because I couldn't. After his surgery, all he does in his crate is cry.
That's
all night.
Well, if that works, I'm glad it works.
Yeah. Yeah. He's better. Luckily, we had insurance because, oh my goodness gracious. So, yeah, I'm very lucky.
Orion and I have the same scar now, Carrie Ann.
Yeah, you have that scar too? Fun.
Yes.
Um,
Oh, yeah.
Except this disappears in his hair.
Yeah, unfortunately. Well, fortunately, because I should not be that hairy, I do not have hair to
You do
hide
not
it.
have hair. No, we don't want the hair for you to hide it.
Hey,
That would be
Cinderella.
weird. Hey,
Hi.
Cinderella.
Hi, Cinderella.
I'll give it another minute and then we'll start a little bit. Well, I can start. I'll start with my story because there's a lot of stuff in the beginning that's not that pertinent. So with fibromyalgia, I tried to find my books that I read that I got way back in 2010. I couldn't find them today. But I learned way back that precursors to fibromyalgia are a cervical injury, childhood abuse, which was surprising, and there was another one I can't think of right now. Dang it. Oh, a shock to the system or trauma. I have all three. Hey Eric, how are you? So
Hi, Eric.
Back in 1988, I had a car accident. Somebody T-boned me. It was completely their fault. Oh, that story is funny. I was delivering for Pizza Hut delivery, and a Domino's driver ran a red light and hit me on Friday the 13th.
Funny.
Yeah. So, he was the second car to run the red light. I saw the first one. You don't think a second car is going to run the red light,
Right? You think that if it's yeah, I would do.
Well,
yeah.
I think they were racing, to be honest, because they were going. It was a 35-mile-an-hour street, and he had to be doing double that to hit me.
You're lucky he didn't kill you.
He hit me so hard. My engine ended up over here, and I ended up the opposite side of the intersection, turned around. I don't know how many times I spun around. So anyway, so I had the cervical injury, and then the other precursor for fibro is the child. Now, what I was reading and said, now I didn't have physical abuse as a child. It was verbal and mental abuse, but it was there. And then the trauma that sparked, I have what they call traumatic fibromyalgia. I got my fibromyalgia overnight, whereas most people, it progresses over years. It takes them years to figure out what's wrong. Sometimes they end up in a wheelchair before they figure it out. I literally went from working full-time, teaching adult Sunday school, doing other volunteer work, to leaving work in an ambulance. And because I couldn't move, I was spasming. I couldn't figure out what was going on. And it took them a year to diagnose me. All I knew, I was so weak I couldn't hold a remote control. And I finally got diagnosed a year later. A different doctor, my shoulder doctor, way before that, said, I think you have fibromyalgia, because I had a walker to get around at 41. And so I went from his office to the Barnes & Noble to find books on it. And this was in 2010. They were on the bottom shelf, so I sat down and I looked, and there was this book. I'm going to find the cover. It's a picture. I found the cover, and it had a diagram of the upper body and all the symptoms. And I started bawling, and we knew him from church, so I had his cell phone number, and I called him and I said, oh my gosh, you're right, this is me. But it took me, that was March. I didn't get diagnosed till that July, so it was a year. What shocked my system was I had been on heavy narcotics for 2 years for a workers' comp injury to my shoulder. And they wouldn't do anything. They wouldn't do an MRI, an x-ray, nothing. All they wanted to do is throw drugs at you. They had me on 100 microgram patch of fentanyl, and you can't control that. And then I was on 10 milligram Vicodin or hydrocodone 4 times a day. Well, I didn't take them as much as I was prescribed. I could control the pills. I always had some left over, but your body in 2 years, your body gets dependent. So workers' comp had finally said, we're done. We're not going to do anything anymore, which I was happy. I wanted it to be done. I wanted my insurance to take it over. There was about 2 months between leaving that doctor and finding a new pain management clinic. So my family doctor, I said, can you carry the prescriptions those 2 months till I get to my referral to the pain management clinic? Literally 3 weeks before my new clinic appointment, he had changed my prescriptions and didn't tell me. And I'd been on the same stuff for 2 years, so I didn't look. And I'm like, I'm about to run out of the pills. I'm like, and I wasn't even taking 4 a day. But he dropped them. He halved it. And so I'm like, I started panicking because I was in so much pain on this stuff. My new doctor, a couple years later, explained that when you're on so much narcotics, it can have a rebound effect. And that's what was happening to me. I was on all these narcotics and still in excruciating pain. I would have to sit at work and type and try not to move my arm because it just was on fire all the time. So they fit me in because I needed to talk to him. Well, he was leaving town for 7 days after that day. So he was trying to get stuff. He didn't even look at me. I was telling him what was happening. And I said, this guy never talked to me, by the way. I usually always saw the nurse practitioner because this guy never would talk. And he goes, well, where's your pain level? And I'm like, well, I have different things going on. And I couldn't even finish what I was saying. He goes, all right, we'll just do this. He took me off everything. Cold turkey. And left town for 7 days.
Oh, Kim.
And it shocked my system so bad. It took me a week of downhill to end up in the ER. And so that's what shocked my system. Then my daughter got it a few years later. She had carpal tunnel surgery, 2 of them back to back. And so she ended up going, my great doctor that I found in 2012, he was wonderful. He had written a paper on Fibro. So I went back on all those narcotics. And the new pain management just left me on it. And but the new doctor, he said, I don't like my Fibro patients being on that much stuff. So he weaned me off, a little bit of each one, not all of it at the same time, and put me on tramadol, which I've been on since 2012. And so and I was on a Facebook support group at that time. This was 2010 to 2012. And, the internet wasn't what it is now, but there was 35,000 members in this chronic pain support group all over the world. And so, I got to talk with other people that had similar situations. And my biggest advice to anyone is never go off of a med cold turkey. And that's I tried to go off my Lyrica a while back, and I weaned off.
Okay, good.
I was almost off of it, or I was off of it for about a week. Scooter Mom remembers. But when I would go to bed at night, all the shocks from the Fibro and the twitches and stuff kept happening. So after about a week and a half or so, I went back on one at night. And since then, I talked to I had a follow-up, and we dropped from 100 to 75 at night. And that seems to be working well. My goal is to get to 50. And then we'll see where we go from there. But yeah, I was... So that's my story of how and why I got fibromyalgia. Traumatic fibromyalgia. And there's 200 symptoms. I've done a lot of research on this. I've had 80% of the symptoms at one time or another or currently. It's easier to tell you what symptoms I haven't had than all the ones I've had.
Yeah.
So that's been a fun journey. On top of both shoulders are torn, the neck injury, and then 6 years ago I injured my lower back. That's where my chronic pain really comes from. I couldn't even sit up after that. And if you guys don't know my story, I'm just going to say this real quick. This is why I bring it up on my channel. I believe things happen for a reason. If I hadn't been bedridden in 2022, I would have never saw the anti-Scientology stuff in my feed. Didn't know anything about it. Came in, it was Aaron's channel. And I went back a year of his he wasn't doing lives all the time yet. He had pre-recorded videos. So I couldn't watch 7 years of videos. So I went back 1 year and I watched it all. And I was, oh my God, shocked. Then I started watching, started finding other creators. Well, then the end of 2023, they put a stimulator in my back. And in January 2024, it was healed. In February, the org here opened. Had I not been bedridden, I wouldn't have found this. And had I not gotten fixed when I did, I wouldn't have been able to start protesting. So
you would have found a different way to protest.
I know, but it's just that I think the universe makes way for things. Things happen for a reason, sometimes.
Yeah.
And that's just the way I kind of feel about it. So
absolutely.
That's my story in a nutshell. So never go.
Cinderella's got a question for you.
Okay. Lord. The most, the fibro fog. When I was working before I got fibro, I could multitask 4 things. I never had to write any appointments down. I could remember everything. Now I can watch a movie one day, watch the movie the next
not
day,
remember you watched the movie.
Not well that, or I just don't remember what happens or how it ends.
My husband is always, he's like, we watched that movie. I'm like, okay. Hey, Jen.
Hi, Jen.
Okay, we watched the movie. Apparently, I forgot.
I got to go back. So I want to go through the comments real quick. Wow. Okay.
Wow, Buttercup.
Yep. Yeah, because it affects the brain and central nervous system. So any shock to that can bring fibro on. Oh, thank you.
For me, the symptoms, it'll vary what is the most important depending on, what's happening. Like, I can usually handle the brain fog, as everybody probably knows. I call it brain farts. I write myself notes everywhere. And if I'm looking for a word and it's not there, I just remind everyone I have brain farts. The chronic fatigue and the pain, it really depends on what is going on in my life at that time as to which one is more important to me. Because if it's that I just can't go somewhere because I'm just too tired, that I just don't have the spoons, then that happens to be the bigger one. If it's like I cannot move, well, then that's the pain. And at that point, that is the more important symptom to me. It just really varies.
It can change hour to hour.
Yep.
Some days.
Yeah.
That's the thing. And I did have one doctor tell me what was so frustrating. He said, don't try to come up with a reason why, like you're having a symptom. Well, maybe it's
try to solve why you have it, right?
Right. And there were people, these are things that I've read. There were people that said they would have rather been diagnosed with cancer because they know there's an end date than knowing you're going to just have this forever. It doesn't, it's not more, what's the word I want? It doesn't cause your end. It doesn't.
DSR shots, Cinderella. Sorry.
But I can't think of the word, you guys.
It's life changing. It's life impacting.
Yeah. It's deteriorating, and it can go up and down.
Yes, and you never know.
It's just not terminal.
I think the hardest thing for me is not knowing how I'm going to feel one day to the next.
Right.
Yeah.
Yeah.
Right.
It's impossible to plan.
Yeah.
Oh, so I'm going to talk about spoon theory. I forgot all about that till you said it. And that is excellent. A lot. Just taking a shower for somebody like us, that's it for the day. And the heat, I don't take showers anymore because it just makes your nerves be on fire. or it makes me shaky. So I have a handheld in the tub and I take baths now. Spoons. So somebody, and the person that came up with the spoon theory didn't even have fibro, but she had something very much like it. So a friend of hers couldn't understand why she was canceling plans all the time, and I can't plan ahead either. And she said, well, it's like this. You guys, healthy people, have an unlimited number of spoons. By the way, it affects the adrenal gland too. So adrenaline, I'll get into that later. And she said, you have an unlimited number of spoons because you can make more adrenaline throughout the day and do your thing. Somebody like us has a finite number, has maybe 10 spoons. Okay. Getting up, there's a spoon. Taking a shower is a couple spoons.
It might take 3 spoons one day and 6 spoons another day too. Right.
Yeah. So,
Yep.
or making breakfast or doing the laundry. And then when you've used up your 10 spoons, you're done for the day.
Spoons. That's it.
You're exhausted and you're in bed. And you can't.
And the reason why she used spoons was because they were in a restaurant at the time and she gathered the spoons from all the tables around them.
You're right. You're right.
So you know about fork theory, right?
No.
If somebody sticks a fork in you,
you're done.
It will deplete your spoons.
Oh, yeah.
Oh, really?
I get what you're saying.
Yeah.
If you have something.
Gotcha.
Yeah.
You can have just get stuck with a fork and then your spoons go away.
Yeah.
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 Cinderella was asking if anybody's had, I think, the DSR shots. I think that's what Cinderella meant.
Is that
SGB is
DSR
the
SGB.
other version of it. Yeah.
Right. Have you done that yet,
And
Scooter Mom?
I have had 2 of the SGBs. Is it 2? Yeah, 2. And Carrie Ann, I know you've had the DSR.
I've had 2. Yeah.
Cheryl had them, and she said it helped her fibro. The rawness got better, so I'm kind of interested in it myself. Where's my other glasses?
I have found. So do you want to tell your background, Scooter Mom?
Sure. So when I was about 33, I was working overnights in a letter shop. So I was at a machine constantly refilling these slots all along this big, long machine. And all of a sudden, over a period of a few weeks, my shoulder would start burning and it would just get worse and worse and worse. And after a while, it got to the point where, well, there was one night in particular where I was literally in tears from the pain and I could not stand it any longer. I punched out and walked off the floor and went home. And I never went back to that job because I just couldn't do it anymore. And that began several years of wondering what was going on. My family doctor at the time didn't know what it was, and didn't seem to know where to start looking. I ended up changing family doctors, and he put me on Paxil, and he would put me on 20 Tylenol 3s a month because he definitely was not into pain meds, prescribing them, dealing with them at all. So when I was a little while after I turned 40, I'm not sure the exact age. If I count back. Okay, so I was Yeah, I was probably about 41. I went to him and said, "Look, I cannot handle this pain any longer." And he had sent me to a neurologist, a neurology surgeon, I think. I can't remember her title. And she did the trigger point exam on me, but she did not actually do the the full diagnosis. She wrote to him and said, "I believe she has fibromyalgia," and she explained the trigger point test. But that's as far as she went. But when he told me that, that gave me something to start looking for online. So I looked it up and I was like, "Oh, what the hell is this?" So, and I stumbled on a support group and started learning more from the people in the support group. The only reason I couldn't stick with the support group after a while was it was so depressing. I would go in looking for help and come out feeling worse than I was when I went in. So I had to give that up after a while, but I at least had gathered enough information that I I knew the types of medications that were being offered for fibro and what seemed to be working for some people and what definitely was not going to do it. And by the way, Tylenol 3s would be on the not going to do it
Not
list.
gonna do it list.
Yeah. So I found out from that same group that to get diagnosed, particularly in Canada at that time, you needed to be diagnosed by a rheumatologist. Those were the only ones who were willing to do the diagnoses at the time. So
Right.
when I was in so much pain and so frustrated, not having proper treatment for it, I finally went into him one day and I said, "Look, either you need to refer me to a rheumatologist or you need to start prescribing these medications that I need now because I can't keep going this way." So he referred me to a rheumatologist who diagnosed me in that appointment. And just having the actual diagnosis in itself was a relief.
Yep.
But my family doctor still wouldn't prescribe the meds that I needed. And the rheumatologist was leaving it to the family doctor to prescribe them.
I ended up in pain management. That's where I finally got something done.
And that's what I eventually had to have happen. I had to go back to the family doctor after a couple more years of that and say, "Look, you're still not prescribing this stuff. And I get that you're not comfortable with that. But if you're not comfortable
I
with
mean,
it, then you
somebody
have to refer me to someone who will." Exactly.
Right.
And he did. He referred me to an absolutely fantastic pain specialist
Oh,
who
good.
I then had for the next 10 years, who she was the first doctor that I had ever met who knew more about fibromyalgia when I walked in the door than I did. And we would have
excellent.
actual conversations sharing information. Like, I even went through a period of when I could afford to, um, of using canna butter and canna oil on my foods to try to help with the pain as well. So it was cannabis, but it was I learned how to cook it and create canna butter or canna oil to put on my food, like in a small dosage through the day because I didn't want to smoke it. And I shared those recipes with her, and she shared them with other patients who were pain patients, including a former cop that she thought would never want to try it. And he was like, "Oh, yeah, give me that."
Yeah. So
So
you people
it was a really good sharing relationship that I had with her, which also made me feel more comfortable when she eventually retired and I had to go to a new pain specialist.
Mhm.
So,
Hey, Annalise.
but yeah. Yeah. So that's the gist of my story.
That's your story. Do you know what brought on the fibromyalgia?
Like Kim, I have a few things in my history. There was some primarily emotional abuse when I was a very young child.
Mhm.
There were a couple of minor car accidents as I was growing up as well. And then, of course, the work that I was doing probably just sort of made it worse. Um, but yeah, like it came on for me very gradually. Unlike Kim, it was not an overnight thing for me.
Mhm.
But yeah, the first area I felt it was my shoulder, and then it progressed from there.
Wow.
I mean, I can't say honestly, thinking about that, I have to correct that because I'm not entirely sure that it was my shoulder that was the first area because I had lower back pain for probably a good 10 years before then. But it was like
Ah.
everybody would just say, "Oh, everybody has back pain."
Oh, I heard that a lot too.
Well, that's what I was. So my journey is a little different, and my journey is that I had I think I've had fibromyalgia since I was a teenager.
That's
Um,
possible.
and I had totally normalized the symptoms. I lived under the idea that what I was experiencing was normal, right?
Mhm.
In the same way you would if you never realized there were glasses and people could see better than you, right?
Exactly.
I just thought it was all normal. So the body shivers, the feeling cold all the time, the joint pain, all of those things were just things, um, they were just the way it was, right?
Yeah.
And so I got sicker and sicker and finally went to the doctor, and she kind of took one look at me and said, "Here, take some Lyrica."
Yeah.
Yeah, well, I was, so I don't have abuse in my background, but I was kidnapped as a child. So
Trauma.
there's some trauma. Yeah.
Hmm.
Mhm.
That's enough.
Yeah.
I mean, that's
So
enough. That's more than most people.
Oh yeah.
um
Yeah.
so I just think I had it very early on and struggled with it, you know, as a young mom, the brain fog. And then on top of that, I had undiagnosed ADHD, right? So sometimes I
So did I.
wonder if the brain fog, you know, is the brain fog the ADHD? Is the brain fog the fibromyalgia? Or is the brain fog menopause? I don't I don't know which one it is.
It's for me. It's definitely fibro because I had
You
such
think
a
so?
quick, like,
Yeah, see, you can
I was
tell.
normal and then I wasn't. I mean, I
Mhm.
used to be able to read a novel a week, and now I can't concentrate on a magazine article. So
Right.
I would
Yeah.
say there's a good chance it's the fibro. That's the
Yeah.
biggest complaint. That and the fatigue.
That and the fatigue, exactly. And yes, I do believe it can be hereditary. I think I have family members who had it. Of course, you
Hmm.
know, I knew about fibromyalgia back in the early 2000s, right? When it was a pretend thing, when nobody
I
Mm.
believed
I didn't know anything.
that it was real. And so that was the other thing. I didn't want to have this imaginary disease that everybody was saying was an imaginary disease, which is what was going on with it at the time. All these women
Yeah.
were just making up their problems, right?
Yeah.
So, um, The DSR shots, my experience of them has been that they seem to have significantly, that and another treatment the doctor here did, seemed to have significantly reduced the swelling in my fascia. So he could see in my ultrasound how swollen my fascia was, and he was like, that's not normal to
Yes.
have that swollen fascia, right? So he gave me an additional treatment that he thought would help that, but the DSR shots have helped somewhat the fogginess, but also just the trauma, the ability to stay calm. But I think that's more related to the PTSD. So,
that was another thing I had to educate my husband about, is mood swings are a big thing with it. And I already had anxiety disorder. Then I got depression because I couldn't live a normal life. The first few years were pretty rocky with it. But answering AA, yes, sometimes. I'll get into that a little bit later, how I got myself better.
Becky makes a good point. If you're overweight, the solution is lose weight. Yes, that was the other thing. What am I going to go complain to the doctors about? All they're going to do is tell me to lose weight.
Now,
all they're going to do is tell me to lose weight.
The reason my doctor didn't, when he met me, I weighed 108 pounds. I was underweight because the day that I went to the emergency room, because if you came in late, I got mine overnight. I left work in an ambulance, went to the ER. My husband had just retired 2 months prior, and he was getting on an airplane in Houston for a contract job in Iraq for 14 months. So the first 14 months I was alone. All I had was my 17-year-old daughter. And so I didn't have anybody to advocate me. I found out it was years later when they admitted me as a psych patient.
Wow.
And somebody from church visited and somebody from work visited, and none of those people ever called me to ask me how I was because they all thought I was a nutcase. But the improvement part, like I said, we'll go over that a little bit more. The thing we were saying earlier about it, AA, is every day is different. Every hour sometimes is different, especially when I was at my worst. Literally every hour things could change. You guys know about the voodoo doll, the voodoo pain? I made that up myself.
It moves. It moves. Right? The pain moves.
Yeah. Well, what it is I get these. So I would cry out just out of the blue, and we called it the voodoo pain. And then in my research, I found out everybody calls it that. It literally feels like somebody has your voodoo doll and they're taking a pin and they're just poking you different places. I get a pain here. It feels like a corsage pin. And sometimes it's inside a joint because it's nerves. And it affects, if you guys don't know, the myofascial nerves. Which, have you ever taken apart chicken and you see that silvery stuff in between? That is the myofascial layer of the nerves that we have. So our myofascial nerves are layered throughout our whole body, and fibro affects that. So I would literally just be, and it's worse when I relax at night, and my whole body will jerk like this. And I'll feel a pain over here, my big toe will hurt, or in my butt, I'll get a poke in my butt or my ear. It makes no sense. It just doesn't make sense.
I don't get as many of those anymore. The medicine, I've been really responsive to Lyrica and some of the other medicines they give me. I do get fatigue, and it depends on the weather, right? I always have a harder time. I don't know about you guys. I always have a harder time in the winter.
I found out about the barometer.
Sure. Every time the weather changes. Oh, yeah. Every time the weather changes, I go through a good week or so of a flare. All my symptoms will all flare up. And it's just like, oh, let me check the weather.
Let me check the weather.
Yeah.
Hmm.
I found that
One
out
second.
from a good I was on vacation and ended up talking to this chiropractor / nutritionist for an hour. I'm going to go into that because that's how I got better. I was typing.
Becky wants to join.
Okay. Hang on just a second. I was answering Eric. Okay. Where's my mouse? So do you guys know about the history of Fibro and how it got finally found out about? I learned about that.
A little bit, but I'd love
No.
to hear more.
Yeah, I learned about this. So they actually think this has been around since the late 1800s. It was called hysteria or hysterical something or
Of course
other.
it was.
Of course.
Of course. Yeah.
So when I was getting these books in 2010, I found out 15 doctors in like 1993 or mid 90s got together and said, we have all these patients with all these symptoms and we cannot figure out what it is. And so they started researching it and they figured out, they still don't know the cause. I have my own ideas about that, but they know what the precursors are. They figured out what the symptoms were. They figured out the trigger points and the blood test. There's a marker in your blood after they go through, and what they normally have to do is see, this is the fibro. I can't think of these words I need that I know. Things that can mimic I look like I had Parkinson's disease for the first 2 years. I had my tremors were so bad that I was still trying to go to church, and I would have to lean against the wall because I was doing this for 2 years too.
Mm-hmm.
And so when I was getting my books in 2010, it takes a while to write the book. It takes a while to publish the book.
Mm-hmm.
So that what was in that book was maybe 10 to 12 years old.
Right.
And by the time I got the book and was reading it, stuff they were doing in the book, they weren't doing anymore. And so it was very new. And one of the books I read was written by a doctor who had it in medical school, a woman. And she wouldn't tell anybody in medical school that she had it because they joked about it and didn't believe it was a thing. My psychiatrist, when I was, because I ended up finally by 2013, I went in the hospital for a week and with the depression. And that's most peaceful week I've ever had in my life. But I was, all those years of the anxiety disorder and stuff, I always had kids and jobs, and you can't do that. And so I didn't have any of that. And so it was so peaceful. And I have problems with all medications. I'm very susceptible to side effects. So I even volunteered to stay 2 extra days to make sure the new meds were going to work. I was like, this is so peaceful. I want to stay here. And, but he said, when I got to my psychiatrist over that, I said, it's hard. Doctors still think it's not real. And he got heated. He said, I went to a convention about this. This is real. And I got, you and I, our stories are parallel because I was 41. I had to get a walker. I didn't get diagnosed for another year. When I finally got sent to pain management I was at a clinic for about a year and they just kept throwing me the narcotics. Finally, January of 2012, so I've now had it a year and a half, I met this doctor who was an angel. He wrote a paper on fibro. He understood it. He would sit and he never acted rushed. He would listen to it took us several years of working together to get what I'm doing now. Now, the one thing he did that I realized I never get more than one new drug at a time. So I weighed 108 pounds because I couldn't get to the kitchen. And because I had to, my daughter turned 18 and I had to make her move out because she was taking advantage of dad being overseas and me being sick. So then I was alone. And I finally put an ad in the newspaper for an assistant. I just wanted somebody to come in and check on me 3 times a week, make sure I was alive, because it was triple digits in summer 2011, and I collapsed on the porch. And I couldn't get in the house. And my dumb butt at the time, you can't see my porch from the road or the neighbors. So I'm like, what am I going to do? I'm just going to lay here. It's 111 to 112 degrees outside. So I'm like, oh, I happen to have one of my neighbor's phone numbers, and he happened to not be at work. My dumbass could have called 911.
Yeah.
I didn't even think about it. I was panicking. So he came over and literally half carried me in the house. So I panicked. So I wasn't even able, I was living on Kashi bars and ice water. So I got down to 108 pounds when I met Dr. Lowry. I probably shouldn't. Well, he's not in pain management anymore. You can't even find him. And he threw 5 new drugs at me all at once. He weaned me off, but he threw all this stuff at me. And every dang one of them had weight gain. This is where we're talking about the weight gain, what I'm getting at.
Most of them do.
Yeah. So I went from 108 pounds to 180 pounds in 16 months. And why do I still have it? Because when you're sedentary, you can't.
It's hard
get
to lose.
rid of it. Even though I went off most of those meds. Although
No.
What Buttercup is saying is true, Cinderella. In fact, one of the things that's not uncommon is for people who have undiagnosed something to be diagnosed with depression. Because if you're sick and nobody tells you that you're sick, you're going to get depressed.
Yep.
The same way if you have an undiagnosed learning disability, a lot of adult women find out they have ADHD, not because they go in for ADHD assessment, but because they show up at their doctor depressed, and the doctor is thorough enough to realize it's not depression, it's ADHD.
Yep.
That's how I discovered. I started taking antidepressants, and all of a sudden my laundry was folded and put away.
Yeah.
I mean, both of them.
Yeah, I'll get with you here in a second, Becky. I wanted to, because Cinderella's having a moment. I know how you feel, Cinderella, because I was alone through a lot of this. And I felt alone because my husband just didn't understand how his fully functioning wife, he left town, comes back, and I'm in bed. And we had a lot of issues over that. So I want to go back to what you said. The tremors. Now, if you go to a rheumatologist, there is a test they can do where they rule out that stuff. And then when they do the blood test, there is a marker when you have fibromyalgia. They can rule out Parkinson's. So you need to
do a fibromyalgia blood test?
That's what they did for me in 2010. Yeah. Because that's all. They sent me to this rheumatologist. He took my blood, talked to me for a few minutes. And next thing I was called back in, and he handed me my results and said, you have fibro, because it was out of town. So then I came back, and that's all I dealt with.
I am not sure that they are doing that blood test yet here.
That's
and
sad.
For those who are not aware, I'm in Canada.
2011.
Well, I mean, Canada always adopts things later than the States. It's like they wait for you guys to, go through all the trials and errors, and then they go, oh, we discovered this new thing that we're going to now allow.
Okay, Becky's here. What's going on with you, Becky? I can't hear you.
Oh,
can't hear you.
Can't hear you.
Are you muted?
Mic's off.
I've got her muted, I think. Hold on. I see the mute. I think it's me.
Oh,
there it is.
Okay.
There it is.
Nope. Still can't hear you.
No.
The mute symbol I saw is gone.
Mute symbol's gone though. Yeah.
Still,
No.
what's going on?
We can't hear you, Becky.
Let me remove you and put you back on. See if that helps. I've had that.
Nope. Still not
No?
hearing you. Maybe it's the
I'm
headphones. I
muted
don't know.
here. I know. I've had it happen too, and I sometimes cannot.
I had a problem when I
Okay.
came in.
Becky's
too.
going to
I
go
had to
out and
reset my
check
mic.
it and come back.
Go out and come
Yeah.
back.
All right, let me put the invite back in so she doesn't have to find it.
Yeah, I have never been offered that blood test. I heard about it years ago and keep waiting for them to, start offering it here, but so far not.
Well, if a doctor, so when my daughter started having issues, so all three of us were going to the same doctor. My husband for his back, me, and my daughter, and we were both in there. And he was talking with her, and she goes, "Well, how do I get diagnosed?" He goes, "I just diagnosed you."
Mm-hmm.
So that's just from talking to her and knowing about me.
Yes.
Yeah.
I make sure my children tell their doctor that their mother has fibromyalgia, right?
Mm-hmm. Mm-hmm. So she's
and
not.
I have encouraged my children to do that. However, I am not sure if they have done it, and we don't share doctors anymore. So,
right.
Yeah,
I encourage them to.
Well,
Yes.
my daughter,
Yeah.
she's on tramadol and stuff, but when she got pregnant with my newest grandchild, she went off, and she just never went back on it. So she was working 2 jobs right after she had the baby. I don't know how she does it, but then again, I find energy somewhere. Scooter Mom and I were talking about it one night. Sometimes when I go protest, it's literally force of will that gets me there, and get going back to the truck is the hardest part because it's uphill, especially when it was 110 degrees. So I was going uphill into the parking. I would get to my truck and be pouring a bottle of water on my head, and then I'm in the car. And literally, when I get home after 3 hours in the car, 2 hours of standing there, I literally walk in sometimes bent over. I have to work my way back straight. And so, but it's literally just my excitement of going, getting out of the house gets me through it somehow.
Yes. Yes, that having something to
AA
do
was asking, yeah.
Yeah.
Related to stress or not.
Stress.
And the other thing
stress can bring it on.
Yeah. And the other thing is what I was discovering when I first started looking at fibromyalgia is there were an awful lot of people who were type A personalities who were diagnosed with it. And if you know anything about type A personalities, hi, Marco, we're the ones who stress out about everything. We have to get everything done. It's better for us just to do it rather than delegating, all of that stuff. So, yeah, stress, absolutely.
Yes. And
I think it's related to the cortisol levels in your body and how your body adapts to that.
And I had a nurse,
which is go ahead.
No, you go ahead.
Which is why I think for me the DSR treatment made such a difference. Is I think it reduced overall the cortisol levels in my body, which is why I think I dropped so much weight so quickly. And
she's back.
Why I've been
Are you there?
Generally calmer. No, we can't hear you.
Still no. I know you took your headphones off.
I know.
Sometimes when I unplug my headphones, it mutes my mic. You can't hear me either?
Can you hear?
Oh.
Can't hear you at all.
Can't hear you at all.
No, it's not.
Oh boy.
That is weird.
That is very weird. Becky, you're never this quiet. What's going on?
Yeah, it's a mic problem.
Let me bring you back in. But no, I'm looking at the settings.
And I now that you've mentioned the cortisol thing, I do remember at some point in my 30s, I think, being told that my cortisol levels were very low, and that was probably because I can't remember the name of the organ that creates them, that sits on top of the
Almond?
whatever it is. Yeah, that they were probably so overstressed that I had very low cortisol levels at that point.
Right.
Thank you.
So
Adrenals.
yeah.
Yes.
Adrenal. Thank you. The adrenal glands. Yes.
I want to talk on that because this is how I explain things to people too. Okay, why we don't sleep. So let's try it again. There's something going on there, girl. Don't know what it is.
No, that's very weird, Becky.
I don't know, Becky. That's weird.
Yeah, I know. We'll figure it out. We're going to be here a while, so you can get it figured out. So what I wanted to say was this. This is something other people don't. On top of the spoon theory, okay, so it affects the brain and central nervous system, which affects the adrenal gland, the pituitary gland, which then affects the adrenal gland. And what it is we are always in, it's broken. So we are always in fight or flight. Our fight or flight system is broken. It's always on. And what that does is it makes you just tense all the time. That's why I get trigger point injections through my neck and shoulders just to release the knots. Mm-hmm. And because so we don't make more adrenaline like most people do. So that's why if you weren't here earlier about spoon theory, we can use up all our adrenaline just taking a shower, getting dressed, and making breakfast. Then we're done for the day. So a lot of people with fibro cancel plans a lot. So then we also don't get to stage 4 sleep. And people are like, oh, I thought it was REM sleep. No, REM sleep is when you're most active and dreaming, and you're only in REM for a very minute part of your, even though you feel like you've dreamt all night, you were literally only in REM sleep for minutes, I think. I'm not sure about that. Stage 4,
deep sleep.
The stage 4 is the rest and repair deep sleep. So we can sleep 8 or 12 hours and feel completely unrested because our body did not repair itself. And that's
Becky,
where
try restarting your phone.
Life. Huh?
What?
Yeah, Becky,
I just suggested that Becky try restarting her phone.
Yeah, that might work.
Okay. I was gonna say I never in my what were you talking about?
Oh, I was talking about stage 4 sleep. And so
I never remember feeling rested in my adult life.
Yeah.
Right? Yeah.
Like you had it longer than me.
Ever. Yeah.
I used to go on about 4 hours before I got fibro, and I was fine. Now, God, and it's so hard to go to sleep because our brain's chemistry is so messed up that
I got medicine for that.
I've tried so many things.
I take the highest dose of gabapentin, which is a sedating drug.
Really?
Mm-hmm.
And I'll take it at 10 o'clock at night. And as many of you know, I will still be up at 5 o'clock in the morning.
I can take the highest dose. I can take 80 milligrams of Adderall and lay down and take a nap. So I've got the opposite.
Yeah.
But I heard in my research about the males, a lot of males probably have it and never get diagnosed because they're not as prevalent to, that's probably not the word I want, to going to the doctor and saying, I have problems, find out what's wrong. You know, they wait till something's really bad to go to the doctor. When my husband says he wants to go to the ER for something, he's probably dying or the doctor, something like that.
Yeah,
There we
Doug,
go.
it probably really does come down to the fact that men are not as likely to go to the doctor and say something's not right.
Yeah.
Um, whereas women are as
This is a
caregivers and caretakers, we have a tendency to be more open and willing to go to the doctor and say, "Look, I'm in tune and I know something's not right. This is what's going on."
and this is a disease that historically is
We're
associated
gonna
with
try this
hysteria.
again.
She's
Yes.
here.
Now you
Yes!
Hello.
can hear me. Now
Did
I
you
This
can't
restart
is
your
hear.
a
phone?
disease that historically
Yes,
is
there was I
associated.
had a phone update.
Oh.
Sorry, guys.
Ah,
I had a
okay.
phone update.
Oh.
And
This is what Marco said.
Yeah.
and it already had updated, but I guess I needed to I am so sorry for interrupting you ladies.
Oh, no, it's okay.
That's
I'm so
okay.
sorry,
We're
guys.
supposed to have more
No.
people than this on. Some of them just haven't made it.
You're fine. So what I was
Well,
saying to
And
answer
before you get
the
started, Becky, I was going to say advocating for yourself is something I learned fairly early
Yes,
on to do. You
Mhm.
have to, because nobody else will do it for you. But sorry, Carrie Ann, go on.
No,
the
please.
hysteria
I just
thing
wanted
with women, because it's associated with hysteria, you're going to have less men coming forward to say this
Mhm.
is my
Mhm.
this
That's true.
is my problem. It was a made up disease that women who had hysterical issues had. So that's not going to be something men are going to be jumping up and down to come forward about, right?
Yeah.
If they can muscle through.
Oh,
Oh,
well,
absolutely.
a lot of the times you have to go through so many doctors.
Yeah.
But something, and this is what I want for those that don't know and only think that I'm just a loudmouth. I'm actually a patient advocate. That's what I do. I've gone to hospitals. I've gone for patients, for patient care. I am a patient advocate. I have been in healthcare most of my life. By the time I graduated high school, I already had my CNA. I've worked for major insurance companies, and I worked for a major insurance company doing appeals and grievances. So I am a patient advocate. It's where my passion lies, is really advocacy. So I know insurance language, I know medical language, and even with all of that, it's taken quite a bit to get doctors to actually listen, because it was always, "You're too fat, lose weight, you'll feel better." Oh, okay.
Mhm.
Well, I ended up having gastric bypass. For those that
Oh,
don't
me
know,
too.
I used to weigh 369 pounds at my highest. Um, about 3 years ago, I was in a car accident that left me like this. Actually, worse. Only, um, yeah, it left me in a lot more pain. Um, and this is actually 2-3 years of physical therapy. This is as far as I've gotten. It wasn't such a huge accident where I went in and was inpatient for months and months. They never actually caught it because I thought I was fine, um, until I couldn't literally move my leg. My leg was frozen. I wanted to walk, and the leg was like, "Oh no, you're not."
Mhm.
And so this has been an adventure. But anywho, the reason that I say patient advocacy is through this and other issues that I've had. Something that I will recommend is, especially if you are being seen for the first time by a primary care physician, which is what normally you have to go through before you start getting all of your referrals and all that other fun stuff. It's going to sound very dumb, but always look your best when you're going to a new physician. What I
I
mean
learned
by
that.
that is, wear something that you would normally wear in a professional setting. No, you don't have to go in with Louis Vuittons and all that. No, we're not talking that. That's not what we're talking about. Most doctors, unfortunately, do judge on appearances. I worked with doctors my whole life.
So you want to look put
So
together.
you want to look put together. Yes, you want to look presentable so that they are concentrating on what you're saying and not what you look like.
Right.
Right.
My other recommendation is when you're talking to a doctor and you're talking, especially when it comes to pain, when they ask you what pain level and people say, I'm at a 10, that immediately tells the doctor that you're exaggerating, because if you're at a 10, then you would be in the ER in the hospital. So never go in there at, I'm at a 10. What I normally do is, because I already know that on the first visit, they're trying to get to know me. They're trying to figure out, hi, it's usually a meet and greet is how I put it. And a lot of the doctor's office, that's exactly what they call it. They call it a meet and greet.
Where you
So
also get to decide if you like the doctor.
exactly.
I mean, a
Yep.
doctor did this to me.
The
And
auditioning
you're
part. The doctor is auditioning to be your doctor.
Yes, ma'am. And I'm sorry, but I'm so blind. And as you all know, that you guys, I only have a phone,
Marco
so I'm
says
not
the
on this
difference
huge
between a
computer.
doctor and God is God knows he ain't a doctor.
Yes, exactly. So when you're visiting for the first time, yes, you are interviewing that doctor. If that doctor, because now with the computers and electronic medical records, half of the time they're not even looking at you. They're looking at a computer. I always judge a doctor's office by how the phone is answered.
Oh, that's good though.
If it's how the phone is answered, thank you for calling Dr. Stevenson. Hold. And then 20 minutes later, they come back. I already know that that's probably going to be a doctor's office that's unorganized.
Yeah.
That's probably going to be a doctor's office that's really busy, and the chances of you getting any type of, quality care, it's probably going to be slim. So that's one way. Another way is, if you leave a message, are you leaving a message with the actual doctor's office? Because now they're doing overseas call centers,
I wanted
and
to speak.
or they do the you need to send a message through the system.
You can't read me.
I know. I'm
My,
sorry.
you were talking about how you looked. My daughter, this is what my comment here says. My daughter was treated by one doctor like a drug seeker because she had tats and
Mm-hmm.
piercings. She finally got help from
Mm-hmm.
my doctor, and
Yeah.
they
Yeah.
talked to her like they treated her like she was a piece of crap when
Yeah.
she really needed help.
Um, the harm reduction aspect that I've been working with some doctors is educating them, as to, obviously, they know the damage that excessive amount of drugs do to your body. Um, and unfortunately, the patients feel that if they talk about using, you know snorting some stuff, they are automatic, but then the doctor is not fully aware of what that patient is putting in their body,
Mm-hmm.
and instead of helping the patient, they're alienating the patient. So that's something that we're currently working with the doctors that I work, and I volunteer this, by the way. This is the work that I do that's not put on a stream. Um, we are teaching. I go into doctor's offices, and especially mine. I've had a neurosurgeon ask, actually, he offered me a job on the spot. And I went in there and I pretty much volunteered to let him know how his office was running inefficiently. But anywho, this is what I do.
Surprised he listened.
Yeah, he did. He had 5 people working the front desk. He saw less than 20 patients a day. There shouldn't be 5 people working the front desk and nobody answering that phone. It was pretty much they were on YouTube I stood there and I just stood there watching this. And so when we talked, I said, well, first maybe they should put away their phone, because I stood there for 5-10 minutes and no one even greeted me.
Wow.
But anywho, yeah. And so getting back to the doctor patient, go in there. When you're talking about your pain, be very specific. I have shoulder pain for the past year that has been bothering me, and it has gotten worse through the last 2 months. When they ask you what your pain level is, you can be honest, but don't exaggerate it, because you think that if you tell them a 10, they're going to go ahead and prescribe what it is that you may need.
Don't exaggerate it, but also make sure that you're telling the doctor, like, if you have chronic pain that's going on, there's a
Yes.
base level of pain that's always
Yes.
happening, and
Yep.
they need to know that separate from other pain. And also, it is true that performance athletes and people with chronic pain often have trouble being taken seriously by pain doctors, because they'll report things like their pain is 9 or 10 and be walking around, because that's what performance athletes and people in chronic pain do. So you have
People
to
like us. People like us.
But also don't minimize your pain.
Yeah,
Yes,
don't
it's so
which is what I'm trying to say. It's this fine line between not minimizing and not exaggerating, right? And I would always
I'll
minimize.
give you an example as to what Carrie Ann is saying. When I went to the hematologist, the blood doctor, so when I went there, my ferritin was at a 3. That's your iron levels. For people my age that are post-menopause, that are no longer having their menses, my iron level should be in the hundreds. I was at a 3. I walked in there full makeup, barely walking, and he looked at my labs, and he's the best doctor. How are you walking? And me stupidly,
Right.
with my cane. No, how are you walking? And I said, with my cane. I walk a block, half a block, I sit down, I walk. I said, it's the back pain that's so debilitating. And then he explained to me that my ferret, and I can never pronounce the word, ferritin was at a 3. That's running on fumes. And he was so surprised that I had on makeup, that I walked in there. I was given, he wanted iron, blood transfusion, and I was all like, oh no, we're not doing that. So we settled on the iron infusions, and I have to sit in a chair for an hour and a half to 2 hours getting iron pumped into me.
I've heard those are really hard. How were they?
Yeah, and I had to have, it depends on Sometimes what they'll do is they'll give you the first iron infusions that I had. I needed to go there 3 times a week, but because I worked at the hospital, I was able, get off of work, go there, no problem. But the hematologist that I have now, he does a higher dosage, but I only have to go once a week. Um, yes, there is quite a bit of people in pain. So again, when you're talking to your doctor for the first time, but now let's say you've already been established here, the doctor still doesn't really listen to what you're saying.
Mm-hmm.
And of course, we have the ice cream man. Um, so the doctor isn't really paying attention. They're so used to you coming in, talking about your pain level is at 9, your pain level is at 10. Um, how do you make them listen? Well, first of all, stop repeating your history, your last 5 years with them, and how you've had the shoulder pain, how you injured, because you only have a certain amount of time with the doctor. Usually is 15-20 minutes for an established patient. So write your questions down. What's different from this visit to your last visit? Um, yes, it is. It's very distracting. What's the difference between the visit that you just had 3 months ago and the visit that you're having now? Concentrate on your new symptoms, or if it's something that he hasn't or she hasn't fixed from your last visit, then again, write your questions down. What's important? Do an elevator pitch kind of a deal. The last visit I had with you, I was still in pain. This pain is different because now this pain is radiating or shooting from the neck down. It's more
You got to use
intense.
words they
It's more
understand.
Yep.
and for the everyday patient, it would sound more like the pain that I had then was just, an aching pain, but now this pain feels more like a stabbing pain or a sharper pain. It happens when, and then insert the reason why it happens. When I walk more, when I'm stressed, when you're stressed, you're right away, all of your muscles tense up, and that causes a lot of the muscles pain
I'm
too.
gonna
What's the
address
question?
that,
I
Doug.
have been so documenting your own pain
Mm-hmm.
is something
I've
that's
done that.
very
I
important.
kept a
Keeping a
notebook.
pain journal. Yeah.
Mm-hmm.
Yep.
Yep, keep a pain journal. What works when? Um, Medications normally they will only work short time. And so if they and trust me, when we have chronic pain, you practically have a list this long of medications. And I know that I was one that wasn't taking my medications as I should. I didn't want to keep popping pills, so I wasn't taking the Neurontin as prescribed. I was prescribed 900 milligrams 3 times a day, which is about 3 pills 3 times a day. Well, I was only taking 1 pill
I did
twice
that
a
too.
day, thinking that one no. If there and it was again the hematologist that asked me how what's your, you go through your list of medications. By the way, always take all of your medication bottles with you to your doctor's visit. Always. Put them in a bag, just throw them in there and take them with you. Many times, for those of us that hate taking 10 medications, many times they can consolidate the meds. For example, let's say I'm trying to figure out one. your blood pressure medication and whatever
Diabetic.
medication can be combined into one, or another medication that'll work for both. So always take your medication bottles. It will give them the name of the doctor, unless you have a really detailed list. But it will always have the name of the doctor that prescribed it to you, what pharmacy you go to,
Mhm.
and the dosage. That's why it's important to take those medication. And it might be a whole bag full, but that also
I know.
lets the doctor know that you're not really, it might be 3 bottles of the same one, just different dosages.
Ugh,
So
so
take your bag of medications. It makes it a lot. So yep,
that's my
it
drug
makes
box.
it a lot simpler. Yeah, yeah. Mine doesn't look like that, but I do have. But again, the Neurontin is the one that took away that burning pain in my toe that felt like I had a lighter to it.
I
And
think I was on that at one point.
yeah.
I
Oh
wanted
yeah.
to.
So it's the Neurontin. Go ahead.
That was some really great advice. I'm glad you came on with that. That's stuff I didn't even think of talking about, advocating and stuff, because I didn't have an advocate the first 14 months, and I didn't get the help that I needed during that time. Doug brought up something I did want to get into at some point.
Oh.
I'll read
Hi
it.
guys. Sorry,
No,
I wasn't
no,
looking at chat.
that's
No,
okay.
no, it's okay,
We're
Becky.
going to be here as
Hi,
long as it
Becky.
takes. So, what he said, and I know exactly what you're saying, Doug. I've been in so much pain for so long that taking my life has entered my mind. If I wasn't a father, I may not be here. That is what grounds me. I am a happy person and never had depression. Part 1. He's going to talk some more. So, when I say I went to, so about 3 years in, I'd never really had depression, but I had anxiety disorder. And you can stay on, Becky, because you might have something for this. So you can come back. Did you click out, or you want to come back in? Was that
And
next?
you're a pain
I
patient
clicked
as
out.
well.
Yeah. So now we're gonna go, I think, more into the chronic pain, which I have both. So I have the fibro, but I got the fibro in 2010. I had a car accident in '88, and I was like, what you said, Carrie Ann, you said you thought it was normal. And so from '88, because it was a car accident on the job, I had to deal with workers' comp. And so I didn't get any help. And I was 19.
And you were a kid.
Yeah, I
Right.
didn't know there was treatment for my neck
Of course not.
and pinched nerve and all that. So I just lived with that until 2005. The job I was trying to get, you had to have a disability to work for them. And so I had to get it documented. So I went to a pain management clinic and started to get treatment for that. Anyway, what you're saying, Doug, chronic pain. You guys know about this, the insurance CEO that got unalived by somebody because
Yeah, that young man,
Yep.
that poor young man has been in chronic pain.
Yes.
now I don't agree with what he
Mhm.
did.
I don't
But
agree with what he
as
did
soon
at
as
all.
I found out, I could
But I
understand.
understand it.
Yes.
Yeah.
My sorrow is that 2 lives were destroyed,
Right.
and it didn't need to
Yeah.
be that way.
Right. And so that's the
Exactly.
chronic pain can wear you down. It can, it is mentally debilitating. And I'll be honest, the only reason I'm still here is my dog Poppy, because I was worried that she wouldn't get taken care of and I couldn't leave her alone. Because actually my husband did not like her at first because she wanted to be between us all the time. But he ended up loving her to death. So yeah, we tend to try to grasp onto something that we need to stay here for. But chronic pain gets too much to cope with. It does, Doug. It does. It's just,
That's why it's really important to
it
have a
takes over your
community
whole
with
life.
people who understand what you're going
Yeah.
through, right? And to
Buttercup.
find that community, like Scooter Mom says, you couldn't stay in that fibromyalgia support group, that chronic pain support group, because it was too
Mhm.
depressing. So you
Yeah.
have to find a community that's uplifting while still being supportive, which is not
Yep.
easy.
No, it is not easy.
Yes.
too.
Yeah, I agree. There have been. I'm looking at some of the comments that are coming up. There comes a point where I know I there was a point where I sat on on the sofa and I told my husband, I said, you know, if God takes me right now, I would be happy. I'm not doing anything. I wasn't thinking of doing any self-harm, but at that point I cannot imagine living another 20 years with this burning going down my leg constantly.
Yeah.
And it feels like torture, constant pain to get up, to move, to try to cook, to try to clean. I had to force myself, pray every morning. God, let me just if I can just get to the bathroom, if I can just get into the bathtub. I took 3 falls in the bathtub because my toe was numb. And one of them was kind of funny now, but at the time it wasn't.
Well,
Um,
so
so
because of the fibro that affects my balance, that's
mhm.
how I injured the 5 disc. I was falling in the kitchen, and if I hadn't have twisted, my head would have hit the stove. And instead of
Yeah.
hitting my head, I twisted and injured 5 discs 6 years ago. And that's what really,
Mm.
I was to the point where I could cook sometimes. We've been getting the prepared meals for years.
The
Fast
HelloFresh
Burger,
kind of thing.
Freshly. I started out doing
I
the meal kits, but I was throwing stuff away because I wasn't feeling like cooking. So now I just get the ones that come fresh and you pop in the microwave. And that's
Oh.
eat pretty healthy. And we're on different schedules
I
because
go to Trader Joe's a lot. I
yeah,
go
we
to
find
Trader
ways
Joe's a
around it.
lot and I buy the days that I really can't cook, I try to keep the meals at under 20 minutes.
Right.
Whatever it is that I'm cooking, keep it under 20 minutes. Now, if I have a special occasion coming up, then I start preparing days in
Days
advance.
in advance.
Um,
Thanksgiving was a slog
I,
at my home.
oh, Thanksgiving, I used to cook for both sides of the family. So we would go to my
Oh, I have a
husband's
good
for
one then.
lunch and I would do I would do the turkey and the mashed potatoes and the mac and cheese. That's normally what I would bring. And then I would do the same for my side of the family, the
Oh my.
turkey and yeah. So I would, and then carrying it from my house, travel to the husband's, finish, put the turkey in there for my family while we're having lunch, and then taking whatever side meals again for my side of the family. And now I just tell him Thanksgiving is his family day, Christmas is mine.
Yep.
I'm not doing this whole back and I physically can't, and I have a lot of help with him. He helps me in ways that I can't imagine. Sorry, I was getting a text. I cannot imagine doing this. Well, I wouldn't have to be doing it if I didn't have my husband going to 2 families, but it's a lot of work. Um, it's just and you find ways to get it done. You find ways of still having to take care of your family, your pets, yourself.
Mm. That's why I went to a walker at first just because I was so weak. But I can go without my cane, but I'm taking my life into my own hands if I do. I don't use the cane in the house, but if I go out, I do.
I use my
Yeah.
chair because then the thing is there's never a place to sit down. And I generally need a place to sit down. It's the standing that does it for
Right.
me.
Mm-hmm.
And so if I've got my chair, I can go further longer, right? And if I need a place to sit, I've always got one.
Mm-hmm.
I'm coming back,
I've
but I
always
wanted
got
to
one.
I wanted to say the same thing for me. Carrie Ann. When I first started using the scooter, people would say, "Can you not walk at all?" And I'd say, "Sure, I can, but I'd
Sure.
like to save my energy for enjoying the outing that I have rather than trying to get there and crawling home again."
Exactly. My friends, when I first started talking about it, they said, "I hate for you to be limited by a wheelchair." And I'm like, limited? I'm limited now. I'm limited now. You're not
Exactly.
considering how it's like saying, you know, when I was a kid and I first needed glasses and got glasses, I put them on and my daddy said, "Well, what do you think?" And I looked at him and all I could focus on was the peripheral vision where it was still fuzzy. I was like, my vision, it's so limiting to have these glasses. And he laughed. He was like, "Your vision's limited already, right? Your vision's already
Yeah.
limited."
Yep.
Mm. I think that's what keeps us going is we're just, I always say I have that
Stubborn.
anxiety that makes you a good employee because you're worried about getting everything done right.
Mhm.
And I'm not a perfectionist. What I am is, I call it, I had a word for it that I used to say. Oh, I'm efficiently lazy. Meaning I will find the easiest way, most efficient way to get something done. I'll still get it done. So at work,
Work
they're
smarter, not harder.
exactly. So I'm kind of like that. But then talking about trying to keep the house clean, I'm like, it can take me all day to unload the dishwasher. Every time
Mhm.
I go in the kitchen, I grab a few things, I put it away. Sometimes I can get Tom to do like the bottom so I don't have to bend over, but not always. So yeah, that's been still my biggest depression is my house. And I'm really getting close to possibly trying to hire somebody to help me. Just I have a layer of dust all over everything. It's driving me crazy.
I have to do things because of my ADHD. I have to do things clockwise. Or else I will go to the kitchen and oh, this belongs in the bedroom, go to the bedroom, start doing the bed, and then oh, I have to go get something from the bathroom. Go to the bathroom, start scrubbing the bathtub, and then I'm exhausted and nothing feels done. So now
Yeah.
what I do is I start at whatever the 12-hour, which could be the stove, for example, and then make sure the stove is clean, move on over to the next, and at least I feel like something was done. And then I just put everything in a basket, and then my husband comes home and he helps me put stuff away that, yeah, and there's only the two of us with my son coming in. I don't even know where the heck he lives, if he lives here or if he lives in Corona. You know, he stays in both places depending on where his job is sending him. Oh, you're not crying anymore. What did Cinderella say?
Cinderella has had a lot of these symptoms early on, and I had that same moment, Cinderella, when that shoulder doctor, I still didn't get diagnosed until July, but in March I was seeing my shoulder doctor, who my daughter nannied for him at church. We knew them from there, and I had the walker. I was weak, had no idea what I had. I thought it was neurological. I really did. And he looked at me one day. I said, I'm so weak. It didn't manifest
Mhm.
in all over pain as much as an all over weakness and muscle spasms at first.
Yes. Oh my God,
And
yes.
he said, "I think you have fibromyalgia." And I went to Barnes and Noble, found the books. I've got it up right here. This is the book that I saw. Let me share it. And when I saw the cover of this book, I bawled and I called him on his cell phone and I said, "You are absolutely right." So, oh crap, it's not big enough. I don't know how to make it bigger.
Complete guide from medical experts and patients.
But it's the cover that I'm trying to. Here we go.
Oh,
it says joint pain in here. I'll use my cursor. Joint pain, insomnia, muscle pain, tingling, fatigue, prescriptions, chronic headaches, forgetfulness, depression, back pain, intestinal problems. And
Right.
I was like, I
Oh.
bawled because somebody finally understood.
Kim, you should put a link to that book in your description when we're done.
Yeah, put a link in,
Well, the only,
and put a link in the chat.
yeah, let me do that. I just closed it, but I can find it again.
Yeah.
It's fine.
And if the doctor's not paying attention to you, there's no reason why you have to stay with that doctor. You know, shop around. Find
Well,
again. I normally, and at least here, I'm able to shop around for doctors. And now because I'm not working, my disability has been denied. I don't have a choice but to be on the Medi-Cal system. Well, guess what? Becky's changing a lot of the stuff that goes on with the Medi-Cal system as well. I actually find right now that being on Medi-Cal and finding the right doctor's office has been quite a huge improvement because I'm actually treated like a human being. Oh, okay.
this is
Yeah,
another.
I wasn't diagnosed with fibromyalgia. I think they do that whole point system, and I wasn't quite there. Mine has to do more with vitamin deficiency because when you do have a gastric bypass, yeah, you're most likely going to be vitamin deficient somewhere.
Especially B12.
So yeah, so I'm fine with my iron. Obviously, right now I just redid my labs. My iron is at a 50 something, which is not where it's supposed to be, but it's not as bad as it was before. So I do need to go in for the other round of iron. You know what I mean? You see, this
Becky,
this
do you
is the
think
thing that you. Mm-hmm.
Do you think the gastric bypass made a difference for you? Do you think
Where it made a difference that you see when I was at my heaviest, I didn't have high cholesterol. I wasn't diabetic. My blood pressure was fine. Which always shocked the doctors. Well, my deal was that I loved pasta, rice, all the carbs. Once I had the gastric bypass, the difference in how it was mostly that the doctors actually listened to me.
Mm-hmm.
Yeah.
Because I wasn't 369 pounds and them telling
Exactly.
me lose weight, you'll feel better.
That's
When
what
I
I was
was
wondering.
I was at 120 pounds and I worked for the hospital, so I knew all of these doctors, not just as some of them as my physicians, but I knew them as co-workers. And this one doctor who kept telling me, lose weight, you'll feel better, lose weight, you'll feel better. And I finally got rid of him because that's all he would look at was the damn scale. So I had the gastric bypass. I went to see my primary, and he was covering for someone in there. So he hadn't seen me at my weight loss. So I went, and I went up to him and I say, "Hey, how you doing?" And he recognized the voice, but he didn't recognize me. And he says, "Becky?" I said, "Yes." I said, "Look, I lost all the weight." And he said, "And?" I said, "You fucking lied to me. You told me lose the weight and I would feel better. You fucking lied to me."
Good for you.
And what did he do?
Oh, he laughed. They already know the spicy Becky. I don't treat doctors just because they wear a white coat. Do I think that they're the high almighty?
No,
They make
they're
mistakes.
doctors. They can make mistakes just like everybody
Yes.
else.
And in that case, what was happening is that I have a mass in my adrenal gland. So that was and is causing some issues uh, for me. We still have to figure out. I have to have the other CAT scan or ultrasound. I forgot what they do now
Oh, me too.
to see if it's growing or not, depending. But Miss Kim, yeah, it's a lonely. It's lonely as much as many people that have pain. It's still a very lonely journey. Um, you don't want to constantly. Let's say we go to a party, and I know damn well that I'm in pain. I don't want to sit there and the pain be the focus of our conversation.
Right.
So but
We
it can
suffer
be
in
a
silence.
very yeah, it can be a very lonely thing to be in so much pain, and half of the time you look decent and they don't understand why. Like this morning I get a phone call from my nephew. Tia Becky, you want to come, and the one that just had the baby, you want to come to the game for the his little girl, for his bonus child. And the game was at 8:30, and he calls me at 7:30, and I'm like, there's no way I can get out of bed in an hour, get ready, get dressed, and drive out there, or Uber it out there. There's no way. Um, but it's those little things you normally do have to plan so that you can save your energy. IBS and gastro problems go with
Yes,
fibro.
they do.
Yes, yes,
Mhm.
yes, they do.
Oh yeah.
Yes, they do.
I didn't even bother getting
Hmm.
diagnosed for IBS. I'm like, I definitely have that. It's not as
Yeah,
bad.
I
Like,
I was
haven't
Yeah,
bothered.
I
diagnosed
don't.
for
The only
IBS
reason
in my 20s.
really?
did the
I don't
medications
have
help?
Yeah.
it. I know.
That's what I was going to say. The only
No.
reason I might consider getting diagnosed for IBS is if the medication helps.
Yeah.
I was never prescribed any medications for IBS.
Okay.
The only thing that I found that helped me was when I was on a low carb diet.
Okay.
For which, by the way, I lost 90 pounds, but lost none of my symptoms, um, except for the IBS. The IBS was suddenly under control. Um, Not to
Dang.
get too graphic, but I pooped like a normal person is supposed to poop for the first time in my life. Unfortunately, those 90 pounds plus came back gradually, and then I started to lose them again after my back surgery. And then those plus more came back after the back surgery and the recovery, because I am very sedentary now, more so than I was before the surgery. So, yeah.
I've never watched her doc. I don't know why, but I tend to veer away from things like that because I just know she's gonna say things that are gonna get me emotional. I need to watch it.
Um the her docu I watched that documentary as well. The only criticism I have is that she's in a very different situation than most of us who
She
are
has money
chronic
to do
pain
all the
slash
stuff.
fibro. Exactly. She's got the money to bring people to her
People.
to do
Yep.
all kinds of
Right.
treatments that
Yep.
we are not able to have or do.
So people
Been
are starting.
fortunate and sorry,
Good.
I've been fortunate with that because I am in healthcare. But on top of it, I have a wonderful masseuse. He does acupressure. He's Korean and speaks limited English. But let me tell you, that massage therapist has really, I feel he saved my life in one occasion. He was doing a massage and he was doing an abdominal massage. And he tells me, Rebecca, you got to go to the female doctor. And I'm all like, why do I have to see a female doctor? Like, I wasn't understanding. Rebecca, you have to go to the female doctor. Well, I just, I figured, fuck a duck, let's just go. So I went and I went to the OBGYN and, you know, they did the exam and they found 6 cysts in a cluster. And I needed them removed because in between that cluster can hide the cancer. It was precancer cells, so it was caught very early, and you know they removed it. So far, so good. But the massage therapy, I could not even. He moved from the lower office to a top office, and I looked at those stairs, and it was like, how? I went up those stairs. By the time he did the massage, I practically ran those stairs down. And he's part of the reason why I'm still walking. And he's not expensive for me. You know, going to him every other week
Adam.
for an hour massage, and he's charging me $70. Plus the $10 tip, we're looking at $50 a week for me to be able to be functional. Yeah, there's quite a bit of. I'm looking at all of how everyone kind of helps themselves and they share little ideas as to what. Now,
I've
keep
heard
in
about
mind,
the
guys, that we're
castor
not
oil in the
medical
belly button.
professionals. Always check with your doctor. This is information that we're putting out there because it has helped us in one way or another.
Well, and
I had
it's
a migraine
important.
specialist.
It's important to talk about it like we're talking about it.
Yeah.
People don't talk about it, right? It's not something that we talk about, and then nobody realizes what is going on with them.
Yeah. And Buttercup, I did not ever have endometriosis, but a very good friend of mine did from childhood. I can't remember which came first, her endometriosis or her period. Like, that's how early she had it. So yeah, I mean, it can be associated with a lot of things. The one thing I keep forgetting to ask you guys is, do you have a memory of having issues with textures of certain materials affecting like your skin and your comfort?
Yeah.
Like I can't, you know, the yarn, putting it on my skin, it's like chalk, like nails on a chalkboard sometimes.
I can remember
only knit with specific kinds of yarn.
Yeah. I remember like both of my thank you, Buttercup. That was very emphatic. I had the same problem, obviously. But what I was going to say was, as a kid, both of my parents are performers, and my mother was the music teacher. So she would have at high school. So she would have shows, performances at her school several times through the school year. And I hated going. I enjoyed the performances, but the seats in the auditorium drove me nuts. And my parents were the parents who wanted me always to wear skirts and dresses back in those days.
My God, yeah.
So my poor bare legs and those seats, I could not sit still for love or money.
Yeah.
So before we get into,
I'm looking at that comment about the little when you wash your clothes and you get those little peel.
Oh yes.
Get
Oh
I
yes.
don't know
The
if
little
you've
the pills.
seen.
Oh yeah.
I
The
have to get rid of them.
Yeah,
shavers.
that little machine. They're about
The,
Mm,
the,
The
10
shaver,
bucks for the big
the
one.
I
shaver,
have one.
Yes.
yep.
pill shaver. Yeah.
It doesn't, but
Yep.
Yes.
mine doesn't get
Save
quite
yourself some
good
money.
enough.
We
But
need to go back to learning how to sew and mend our clothes because shit is
I've
so
saved a few
expensive
things
now.
that way. But t-shirts and stuff, I get like cheap t-shirts. And because I have a limited
Yeah.
number of clothes because I don't work, they get washed a lot. So it just, those are actually, the t-shirts are just, I can shave. I have a really good shaver, but it doesn't always get as close as I would appreciate. My
Yeah.
skin would appreciate.
And
So I just
you
Right.
don't have to buy the clothing shavers. A good disposable razor is just as
Oh
good
yeah, I've
on a
seen
hard
that.
There you
surface.
go.
Oh,
Yeah.
that's true.
So I just
And if
bought
the
some stuff
t-shirt
real
still
quick.
doesn't feel right, I tear it up and that's what I use for dusting.
Yes.
T-shirts are
Yep.
great for windows too.
I
Oh, my
grew up
husband
doing
did
that
that.
too, Becky.
Yeah.
Growing up, well, you probably know this, Scooter Mom. Growing up in a cold climate, scratchy things. And they
Oh,
always
Mhm.
wanted to put you in scratchy shit
yes. Because it keeps you the warmest.
because it
No, it
keeps
doesn't
you
because I'm going to be
warm.
pulling it off.
Oh my
Yeah.
God, it's so awful.
Yes. Yes.
I
Acrylics
we
have been my
here my
best friend.
Yes, it wasn't until I was in my mid-20s and met my husband that I started to believe that it was possible to have experiences in the cold where you weren't cold or itchy.
Yes. Exactly.
well, my
Worse.
mother used to bind my
Exactly.
waist. So, because, you had to have a tiny waist and blah, blah, blah.
Uh,
So when we would go to church, no pants to go to church. It was always skirts. It was always dresses. And then under the dress, she used to tie, about, if it wasn't even a ribbon. It was more like a rope, kind of about this,
ooh.
and she would tie it around the waist so that I would have a smaller waist. Well, lady, yeah, I have a small waist somewhere in here, and I'll try to find it now. But I was just never the skinny kid, but I was always very strong, and so I might not have been the 90-pound kid, but trust me, my weight never really kept me from anything. I would go on the monkey bars. I was very strong. um but that just kind of what you guys said, that just, sorry, I went off topic.
That's
Okay.
okay.
That's okay.
We're not
So something I wanted to,
Discomfort.
Becky.
I brought something up that I'm going to share. There are 200 symptoms of fibromyalgia. I'm not going to read them all, but I'm going to show you this. I've had almost 80% of them. So let's go. Sorry, I'm scrolling. So autonomic nervous system, endocrine, immune, and hormone. I've had, let's see, abnormal sensitive. These are the ones I've had. Abnormal sensitive to hot or cold. Allergies got worse.
I was
Chills.
about to say allergies have to be there.
Yeah, I had allergies before,
Mhm.
and they were kind of cured through the serum. Came back. Chills or shakes. Oh, when hungry. That I never heard. Cold hand and feet. I'm like that all the time. Feeling hot or cold often. Flu-like
Always.
symptoms. Mild fever. Extreme fatigue after minimal exertion. Hair loss. I've had that. Shingles rash. That's a new one. I haven't had that though. Let's see.
Ooh.
Increased.
Always get
So
your
you know we
shingles
need the link for
vaccine.
this
Just
too,
as an
Kim.
aside about shingles,
I
always
disagree.
get your shingles
Mhm.
vaccine.
The only reason is my husband had one outbreak, and it wasn't that bad. and he went and got the shingles vaccine, and now he gets it more often and worse. That's just him. I'm not going to tell anybody not to get it, but I haven't gotten it because of that. So let me go back here. Actually, what
Because I
I'm
had
I've
shingles,
had
and
a
they are not
coworker that had
fun.
shingles.
I will.
No, they're
I
not.
will.
No,
She had
and
shingles all on
my
her head.
daughter's,
And I
yeah,
and again, ask your doctor about this. When my mother started with the shingle rash, they immediately gave her the vaccine, and luckily it didn't go past that. So again, we're not doctors. We're not telling you guys what to do. We're just giving our experiences here.
right. Exactly.
Yep.
This was a big one for me when I found out temperature irregularities. We cannot regulate our body heat
Yep.
because it's all
I
up in the
hmm
air.
spent my whole life always being cold. I'm
I was
always
always
cold.
hot.
I'm
See,
I
I'm the
always
was always
exact
cold.
hot.
opposite. I'm always hot, but I have to have the ability to cool my chest, or
Interesting.
I will just keep overheating. I
You know what
have
I
to have
do?
air flowing at all times.
Yes.
Yep.
So,
I
especially
have
in the
to have a
winter,
space
it
heater
is
next
so
to me with
frustrating
warm. Yep.
What
because
I
I'm
I'll
the
get
one that
on the
will have the
Wheel-Trans
heater
bus
in the
and they've
house
got,
and then open a window.
yeah, I'll get on the Wheel-Trans bus and they'll have the windows all done up tight and just the heat blasting. And I'm like, I've already taken off my coat, scarf, gloves, and hat. Could I please have some air?
Right.
so I eat
You when I went through menopause, and I was getting those hot flashes, and my husband couldn't understand. And I went into early menopause. Again, talking about doctors. I was, and sorry guys if this is too much info, but my menses were extremely heavy. I went to the doctor and I told them this is unusual. I went to a new OBGYN because mine got a promotion. And I went in there as her first time patient, and she was a fairly new doctor, meaning out of school. And I normally don't shy away from them because they know quite a bit of the new medications and the new stuff. So I don't care if my doctor is a brand spanking new. If they're competent, I'm cool. But in this case, she didn't examine me because she figured it was a first time patient and I just want to get to know you. Well, I explained to her that they were extremely unusually heavy, and I saw her on Friday. On Saturday, I woke up in a pool of blood. Um,
Mm,
by Monday, I went into the ER on Sunday after, I was just passed out. My husband thought I was sleeping. And Monday, I went into the ER and I ended up having an emergency myomectomy, meaning that they went in there. It was a fibroid, a protruding fibroid that was causing me.
mm,
I had just had an iron infusion 2 weeks earlier. Um, and yeah, when I went in, I was well, I'm already 5 hours in the ER, and I'm like, you know what? I might as well die at home. That's what I told them. The nurse looked
mm,
at my labs that they had done stat, and she told me I would suggest that you wait. Um, so I did. The doctor went in. They did an emergency myomectomy. They went in and they removed the fibroid, and with that went the rest of my ovary. So that caused me to go into early menopause. um and it wasn't a gradual thing. It was just like, oh, you're in menopause, congratulations.
Mine
So
didn't feel gradual.
I
It
mm.
felt like all of a sudden, like I would be sweating in the middle of nothing for no
Well, it
reason.
feels like, for
Mhm.
for those that are too young to go through it, or for the men that don't understand their wives, it feels like when you open an oven door and that heat just that's exactly how I explained it, because of course my husband wasn't understanding it. Well, what does it feel like? Why I would be dripping in sweat, and it
Right.
would be cold. And because Becky loves to torture her husband, I put the oven up to 450. I let it heat up, and then I said, "Come here." So he comes over, and I opened up the oven door, and I said, "That's what menopause feels like." And so, but I would carry frozen water bottles. I would just stick them in the freezer, and I would just carry frozen. I would carry the frozen water bottle with me. So whenever I got a hot flash, I would just, you know, kind of put it on my neck. Because it's embarrassing being out in public, and all of a sudden I'm doing this.
All of a sudden, you're
you know,
trying to.
yeah, and people are
Yes.
looking at you, and so I would just kind of get the water bottle, and and it helps with the neck pain too.
Right.
It helps with the what's wrong? My neck hurts.
I still carry a portable rechargeable fan all
Yes.
year round. And I added to my collection with a neck fan a couple of
Yes.
years ago.
You still
We
have
find
those sometimes,
ways.
huh? I haven't had one in quite some time.
I had them way before menopause started, though. They started right around the same time that my shoulder burning symptoms started. I started having a lot of trouble regulating my temperature around then. Before then, I was fine. I never really noticed any problems. But all of a sudden, you could have just a little extra sunshine, and I would be like soaked. Yes.
Yeah, our own personal summers. I
Mhm.
had
This
4
is an amazing.
miscarriages, so
Can you scroll up a little bit, Kim?
Yeah,
I've never seen.
This is a list of things I haven't looked at it in years.
Kim,
There's stuff on here that's new. Which part you want to see?
Difficulty follow. I
Can you
want to
share
scroll
the
up. I
link
want
to this document
I
in
definitely
chat?
will. Okay, hold on.
I'm looking
Their
at the
cognitive
forgetfulness.
function. Okay.
It's called Ridiculously Long List of InvisibleIllness.org. So let me copy it. Hold on.
Yeah, the forgetfulness because of my family history with Alzheimer's. My mother's older sister had it. My mother has it, and now her younger sister has it. So, me forgetting things, I really thought it was early onset dementia or the beginning symptoms of it.
I'm sorry.
It turned out that it was my iron levels. And again, when normally when you go to the doctors, they do labs, they really don't do a full panel. I would say seriously, if nothing else, ask them for your vitamin panels. That normally can help you at least 40%. Once my iron was on check, the vitamin D, the vitamin C, the cramping and the spasms. I call them fat spasms because they always get me right in the fat right here. That seemed to help. So now, I do have to take, 50,000 milligrams of vitamin D once a week. So I do take the vitamin D, vitamin C, everyone. Vitamin C, it's very important. It helps you absorb some of your other vitamins. Not only that, but the cataracts. It helps slow down the cataracts, is what my eye specialist told me.
Really?
And eventually, yes, vitamin C.
At what kind of dosage level, Becky?
I have to go and check the bottle, but I take the vitamin C, and that helps with the either the prevention of it, but most definitely with how fast or how early you're gonna have it.
Okay.
So
I'm
And for
backwards.
those of us that are going through menopause and having vision issues, menopause can also cause you to have dry eyes. When your
Yep.
eyes are dry, they couldn't figure out why. I went and got my glasses. Yep, there you go. I got my glasses. And then when I would go back 2 months, 3 months later for, because now they were checking for glaucoma. I was a glaucoma suspect. I finally been diagnosed with the glaucoma, but my prescription on my glasses would change so drastically. It turned out that I have really dry eyes. So just the eye drop gel, not the regular
Yes, the eye
lubricant, but
drop
the
gel
eye
makes a
drop
difference.
gel. It makes a huge difference. My eyes are usually red because now the eye
Thanks,
drops that
Phoebe.
I take, that I time release, yes. Um, so check your vitamins. That sounds something so simple, but it's overlooked by many doctors.
Also, the vitamin D, I get D3. I was told don't even get the regular D, get D3.
Mhm.
And
D3.
I read many years ago to take 4,000 IU D3 daily at minimum.
Mhm.
And I verified that with an endocrinologist earlier this year, and she said, yeah, you stick with that dosage because it's perfect for you. So
I'm looking at biting at your cheeks or tongue frequently.
I didn't know that was. I
I didn't
I
did.
know that
didn't
was a
even know that.
symptom.
I'm constantly doing that. Yep.
Mhm.
One of the
I
big
didn't
And I'm
even know
sure
that.
it, and everybody can relate to these. So don't think that you automatically have fibro.
right. That's the
Again,
thing
make
is it
sure
yeah,
that
mimics
you're
a lot of
keeping
things.
logs. You do not want to
I
be on a
lose my balance
medication
when
that you
standing
don't
with
need.
my eyes closed all the time.
Oh yeah,
Yeah.
I mean,
yeah,
this
that's
is.
part
And
of
by
I'm
my
the way,
looking
I can
through this
also
psychotherapy
lose my
list.
now.
balance sitting down with my eyes closed.
Yeah.
Yeah, yeah.
I'm looking through this list and finding things going, oh, that's interesting. I never knew that was
There's
a
more on
symptom.
here
I
than I
never knew that
originally
was a
saw.
symptom.
I
But
know.
the thing is, these are things like impaired coordination, bumping into things frequently. These are things that
Yeah.
other people have commented on for me
Mhm.
about
Mhm.
for my whole
Mhm.
Yep.
life. This isn't just my feedback, right?
And if
This
you guys
Yeah.
don't
is
know, she's had Carrie Ann's had fibro probably since you were a teenager. So you had it a
probably,
lot longer than us. So that's what she's
I
talking
wasn't
about.
diagnosed. I
Right.
mean, of course, I wasn't diagnosed then, but
Right.
I'm pretty sure
Well, it
based
used to be
on
considered a diagnosis that they would give you just because they couldn't figure out what was wrong with you.
right,
Oh, you have
right.
fibro. And then they would call it a made up
They did
diagnosis, a
that for a
made up
long time,
disease.
right. I wasn't
Yeah.
officially diagnosed and given any medication for it until 5 years ago. So
Mhm.
it's really not been that long for me.
But yeah, I didn't need
Yeah,
glasses
I
for the
was still
fibro.
haven't been diagnosed, but I don't need another diagnosis on my damn chart, you
Yeah,
know?
no.
Right.
Really.
It's not like
Sorry,
they
my
can treat
camera's
it
not
as a
focusing very
whole.
well.
I've got to
Yeah,
run,
it's not like they
guys.
can treat it as a
Okay.
whole.
Thanks for being
Okay,
here.
bye, Carrie
Thanks
Ann.
for having
Well,
me. Good to see you
But
all.
hey, Carrie
Good to see you
Ann, have a good
too.
one.
Yeah. Talk to y'all
Um,
later. Bye-bye.
I thought Pup was
so
going to come on. Oh, there she
yeah,
is.
I thought so too.
There she is.
There she is. So vitamin
Oh,
B12.
there's
Yeah,
I
it's
was
good for
just
your.
gonna say vitamin B12. I take 1,200 micrograms, time released. That's my favorite version
I
of
take
any
more than that.
vitamin. And B100 complex. Your B vitamins are very important, and I'm not talking niacin. Okay.
Yeah, real.
and not in their dosages. Okay.
So I did want to try to get into things that we have found that work. And then, Pup, we're going to talk about. Before we do that, I want you to tell us your story first because we'd already done
Well,
ours.
Yeah.
I do not have a true fibro diagnosis. However, the things that I have contribute and could potentially eventually lead into a fibro diagnosis.
Mm-hmm. A lot of
So,
times, many years.
yeah. I initially, things started when I was in a car accident when I was like 8 years old.
Sorry,
Mm-hmm.
is your mic hooked on correctly? You sound a little muffled, and that's not usually you, Pup.
I should be going through my headset.
Oh, okay. Again,
I can hear
it
you.
might be just me. Heck.
Yeah, I can hear you clearly. It's just, yeah, your sound is kind of
A little
less
muffled.
clear and
We can
crisp.
hear you just
I
fine.
may have dropped
But
my
we can hear
headset a
you.
little too many times.
Oh, that'll do it.
It took me 10 tries, so. But we
Yeah.
can hear you. Sorry,
Yeah,
Pup. I didn't mean to
For real.
interrupt.
you're good.
Go ahead.
So that's when things started. Um, they now, in the last couple of years, I am 42. In the last 2 years, they finally said that that was probably the start of things for me, because that's when, from that point on, from that car accident, I get chronic tension migraines, and I get a muscle spasm that starts up here behind my ear, and it's always on the right side, and it shoots down my neck, through my shoulder, and ends in my elbow.
Mm-hmm.
That started at 8 from the car accident. And then by the time I was a teenager, horrific cycles. I'm talking cramps so bad I'd end up, I'd be walking down the hallway in school, a cramp would hit me and I'd hit my knees. And I have an extremely high tolerance to pain, always have. Over time, they got worse, and it would literally make me sicker than a dog every month, like on the verge of being in the hospital for transfusions and stuff, because I'm bleeding so badly. For 7 straight days, not leading in for, and then bleed heavy for a couple days, and then bleed out. No. When I started, it was horrific from beginning to end for 7 solid days, making just life in general exhausting and painful and sick. I couldn't eat. I couldn't do anything. I couldn't function. And that part got better for a little while after I had my kids, and then it started getting bad again. Digestion issues, horrific IBS, the whole 9 yards. And then I have always been bad with my balance. I've always had issues with tripping over air and being clumsy. I mean, it was a joke in my family about how clumsy I was. And it was excessive. I'd asked doctors over the years. I can't even tell you how many doctors I asked over the years. Why am I so clumsy? Why do I trip over air? I can be standing there, and the next thing I know, I'm catching myself from falling. I've broken bones from falling, and that's not normal. To occasionally, but I've broken my foot, I've broken my arm, and I broke my tailbone severely. So over time, things just got progressively worse. Overall, generalized pain that I couldn't even pinpoint where the pain was coming from, to the point where, and this makes me emotional, My mother was put out of work on disability when I was a senior in high school. And I worked 4 jobs my senior year trying to graduate and keep a roof over our head. Many of you know I do not have a relationship with my mother. She's very toxic to me, to my family. She thrived on having somebody take care of her, on doing for her, and always picking up the pieces of the mess that she made. And it was always me, because my brother was the golden child, and I wanted to protect him from her. But when a couple years ago, it got to the point I got off work on a Thursday and I came home and I was literally in so much pain. I couldn't move. And my kids put me in bed and took care of me that entire weekend for literally everything I needed. And that weekend, I broke. Sorry.
It's okay, Jen.
This part always gets me. That weekend, mentally, emotionally, physically, I broke. I couldn't do it anymore. I could not do to my children what my mother had done to me.
Mm-hmm. I had that same thing. I would never be like her.
I was not going to give life an opportunity to intentionally make my children resent me for having to take care of me. Because that's what my mother did. But I wasn't going to do that to my girls.
I'm gonna tell you, your girls are very strong, and that's just a
They are.
reflection of how you raised them.
They are amazing kids. And that's
They
not
steal
all
your
me.
popcorn.
That's them. They steal my popcorn. That is a reflection of them, not me. But that weekend, it finally was the breaking point, because I'd been treated so badly by the doctors here that I had given up on medical care completely for almost 10 years. Because I couldn't trust the doctors here. And that weekend, we had a new rotation of new doctors come in, and I'd been hearing a lot of good things about this one doctor. And Monday rolls around, and I call and I made an appointment. But because of the history that I have with the clinic here, because I'm not normally with you, Kim. So for your viewers that may not know me, I live in the middle of nowhere. You are not allowed to practice medicine in this town if you do not practice at the clinic. All of our doctors are housed in that one building. And I've had such a hard time there that I didn't go to the doctor. I didn't do anything. It wasn't, I wasn't going to go, but I had to after that weekend because I physically couldn't move. You know, my oldest will be 16 soon, and my youngest will be 12 soon. I'm not going to put them through that. And what I went through having to take care of everything. I wasn't going to do it. So I finally went. And when I went to this doctor, the first thing I did is I told him what I've experienced with other doctors in this clinic. And flat out that with my past issues, I don't take pain medication. And he's going to have to respect that. Anything addictive, I won't take. And he's going to have to work around that, period. There is no ifs, ands, or buts. There's no, let's try this. No, it's not going to happen. And he has to respect that. Something is wrong with me, regardless of all the other doctors saying that just lose weight, you'll feel better. Or massively over medicating me and turning me into a walking zombie, to where here I am in my 40s and I still don't remember 6 months of my life in my early 20s.
Mm-hmm.
Because I was so heavily over medicated. So either you're going to help me, believe me, respect my stance on certain things, and help me figure out what the hell is wrong with me, or you're not, but you're going to tell me what you're going to do right now. Because I'm done.
Mm-hmm.
Luckily, he got on board real quick.
Good.
And we've since found out that I have joint hypermobility syndrome, which can affect, it's basically a very basic terms, it's a collagen deficiency in the body. The body's inability to maintain collagen, absorb collagen, and collagen is one of the building blocks in our bodies.
Mm-hmm.
It makes my joints, all of my joints are weaker than they should be. So if I fall or I stumble, what should be a simple injury is a very significant injury for me. As a woman, it also compounded the prolapse issues that I had.
Oh, I remember.
Because 2 years ago, I had to have major internal reconstructive surgery because the IBS, the hypermobility, and just in general from having 2 C-sections and being a woman, I literally was losing all my innards, not just my uterus, but my vaginal canal, my uterus, my bladder, my rectum. Everything was falling and coming out. And I had issues with the doctor here for the gynecologist here. I had issues with him, and I literally had, I know this is a lot of information, and I apologize, but as women, this is something that we all need to know about, that it's a possibility of happening as women. My vaginal canal was literally coming out by that far and turning inside out. And that doctor told me, it's not that bad. Go on YouTube to this specific pelvic floor physical therapist and follow her videos. Yes.
I had a doctor that told me something similar. And I told them, fucking YouTube is not my doctor.
17 days later, I had a second opinion in Vegas that doctor was so absolutely furious. He, in the middle of the exam, hadn't even completed the exam yet. In the middle of the exam, he looks up over me, looks me dead in the eye, grinding his teeth, shaking his head, eyes bulging. He says, "If I had my say, you'd be having surgery tomorrow." There was no amount of physical pelvic floor physical therapy that would help that. I was a full level 4, which is the worst.
So
6
You know,
weeks
my
later, I
mother
had
had something
surgery.
similar.
did it
Yeah.
did it help? Did it go
Where
well?
it's coming out of your
Yeah,
yeah. Yeah.
yeah. So what ended up happening when I had the surgery, I had a hysterectomy, because there was no saving that at that point,
She,
because
yep.
a third pregnancy could potentially be a death sentence for me. I probably would not have survived a third pregnancy. And they still would not give me a hysterectomy, even though I had horrible cycles, even though a third pregnancy could potentially kill me. They still would not give me a hysterectomy when asked. Wouldn't do it. You're not old enough. There's not enough medical reason to do it. That's what I was told, even though my husband was asking with me. They still wouldn't do it.
This
So
is what we
this
talk
time
about
we
the
finally,
patient advocacy part of it. You
yes,
advocated for yourself.
yeah. And my husband advocated for me as well when it came to this stuff.
Yep.
He was with me through all of this because it's such a male dominated field. Sometimes you have to do that, and it's stupid. I'm the one that feels the pain. I'm the one that's sick for 7 days every 21 days, like clockwork. That's me. I'm dealing with this. Listen to me. And I understand. Oh well, we have such a opioid pandemic, and I get it. But when you have a patient that is telling you, what can we do to fix it so I can stay off of that shit? Why aren't you listening?
Well, they took it
Why
from one
aren't you
extreme
listening?
now to the other, where before they used to give it to you like candy. And
Mm-hmm.
Yep.
now, this is part of the
Mm-hmm.
reason why we have such a huge issue with some of the street drugs.
Yes.
But
So the surgery, they finally gave me the hysterectomy that I've been begging for 10 years for. So I
Jesus.
finally had the hysterectomy. Then because mesh is such a problem right now for
Yeah,
women that have had this
yes.
type of surgery,
Yep.
repairs with mesh, they opted for a mesh-free surgery repair, um, which actually is better for me in the long run, personally, individually, because of the hypermobility. So in my case, they went in, they repositioned, lifted, and stretched out and secured the vaginal canal at its full length, like it's supposed to be. Repositioned and secured my bladder and my rectum back in position. But now, instead of being held in place with connective tissue like a normal person, in my case, it is being held in position with scar tissue, which for me is much stronger because of the collagen issue. I also, when I fell 5 years ago and majorly broke my tailbone. That actually ended up setting off, that was a trauma that set off CNS, central nerve sensitization. Basically what that is my body is caught. You have your peripheral nervous system and you have your central nervous system, your main and your secondary. Basically, my body is caught in a chronic feedback loop, pain signal going back and forth between the nervous systems. So it's chronic pain.
Mm-hmm.
I still can't sit well. But I also, because of overall joint pain and weakness, I also, from the hypermobility, I also can't stand for long periods of time. So I'm what do you do? So yeah, in the end, the hypermobility it is a step below Ehlers-Danlos, which has lots of heart issues, all kinds of stuff. Because we're now dealing with nerve issues with the CNS, that could potentially progress into a fibro diagnosis over time.
I could see that. Yeah.
Again, going through that list that you had up, I am horrible insomnia. Horrific.
I don't know if we were done with it. I'm bringing it back up. It was covered. You were too small while you were talking.
Oh, okay. I can't tell you the last time I had a dream at all. I can't. I don't remember ever dreaming. That's how long it's been. I don't sleep deep. I don't hit that deep sleep at all.
Thanks, Anthony.
Yeah.
Chronic pain is an epidemic.
Yeah.
Again, we
I was
go
going
back
through that, and it's
they
like
go from one extreme to the other.
Exactly. And then you have people like me. I have been clean, 25 years now. And for me, I refuse pain medication. That is just not, I don't take pain medication. My husband had to fight with me after my surgery, my reconstruction surgery, to take pain medication to make me sleep through the worst of the pain. And my fear of getting addicted again is bigger than the pain, because the pain is temporary. That's what I keep telling myself. Even though it's not, but so yeah, I don't muscle relax. I don't take any of that at all.
It's a lot to take in. I mean, can you just imagine just the physical aspect of it? Then comes the mental. Then you have to worry about your partner and their needs. I can, and I worked OBGYN for 2-3 years. Godly, I don't even remember anymore. And this was a high-risk OBGYN office that I worked for. And we saw it all. I mean, women would come in there in menopause, and and this is going to be a little graphic, but because we don't talk enough about it, they didn't realize that sometimes having a hot flash in the middle of being with your partner, can gauge their temperature as well. And I mean,
well, and that was,
guys.
Part of what I went through with my women's issues, womanly issues, that didn't just affect me. It contributed massively to the internal chronic pain, because everything was falling. It was actually pulling on my spine internally as well. It was pulling on all of the connective tissue, all of the muscle structure. It was contributing to a lot of the pain that I was having. But also, because I'm hurting in that area, I didn't want my husband touching me. So what does that do to my self-esteem? What does that do to my mental health? What does that do to his mental health? How does it reflect in our relationship? There's so many things that it just, same, Kim, same. That chronic pain and chronic pain diseases affect. It's not just us. It affects our mental health. It affects our children. It affects our spouses. It affects so much more. And then you had women's issues on top of it: menopause, prolapse in my case, bad cycles in my case, and in many other women who are being downplayed by their doctors. And it just, it torques the noodle.
Yeah, yeah.
The
Yeah, we
turkey
were
noodle,
talking
not
about
the turkey noodle.
we were talking earlier about just chronic pain in general, not a specific disease. Eric was talking about, we did talk about that earlier, what it does to your mental health. And 3 years in, I ended up in a mental hospital twice, but that was the first time. And because you go from it wears on your mind so much. Just, and especially with some people when they're not getting diagnosed, or they're getting a doctor
They
that
make
doesn't
you
want
feel
to
like you're
listen.
crazy.
Well, Jen knows.
Exactly.
So I went in the ER. I got my fibro overnight, and I couldn't move without my whole body was spasm, and uh they admitted me as a psych patient and didn't even tell me, because I couldn't move, so I was in a regular hospital room. But everybody that came to visited me knew. So church and work came, and nobody ever called me again after that to see how I was, because, oh, she's just a nutcase. So everybody, all those people to this day, 14 years later, just think it was all in my head.
And
Well, how did they know
that's
your
the part that
diagnosis
just
before
gets
even
me.
you knew it?
Right. What you know what happened?
It-
So I'm in there, and I can't move without spasming. So, and I was very weak, and they did a CAT scan. Then they let me lay there, and all I had to advocate for me was a 17-year-old girl. My husband that day was getting on a plane to Iraq for 14 months. So I had nobody, because we're military, so I have no family here. I cut out friends. She's all I had. And she did at least say, looked at her like, so this ER doctor that had just come on shift walks in and says, well, your CAT scan was clear. We're going to discharge you. And she looked at her like she had 3 heads, said, my mom can't move. So they had me try to sit up. Now, you cannot fake what my body was doing. Whenever I tried to use a muscle, it would spasm. See, this doesn't even show you what I was actually doing. And they're like, oh, well, I've never seen symptoms like that, so it must be psych. And every person that came to my room for 8 days, I told them what was going on, and nobody would listen. And it took
I've
years.
come to, so I had, and again, this is why we're talking also about patient advocacy. I went, one of my mom's employees ended up in the hospital, severe abdominal pain. When a woman has abdominal pain, it can mean a plethora of things. It can mean anything from your ovaries to something more chronic. In her case, they tried to discharge her. She called me and she said, Senora Rebe, they're trying to let me go. So I hightailed it over there. Yeah. And because I have done the quality of care with insurance companies and figuring out what was going on, I called a gastroenterologist and I said, I think I might need you to come visit this. I don't have privileges. Don't worry about it. I was really fucking with the nurse there. So I asked for the medical director. Medical director finally ordered for her to have an abdominal ultrasound, not an ultrasound, a CT scan. Well, they were trying to discharge her. She knew she was in a lot of pain. They pretty much just touched her belly. No, it's not your appendix. It's not in a, So turns out that she had a bleeding ulcer. Could have killed her. Could have killed her. That's what she had. She had a bleeding ulcer. Sometimes maybe it is a little bit that we're not doctors. We didn't go to school for whatever amount of years, but we know our bodies. We know when something is truly wrong.
Yep.
We know when something is not functioning well. That's why when I mentioned about being an advocate for yourself and over exaggerating your symptoms, and yes, we do have some of us that are like, no, I'm just fine, I'm okay, nothing is wrong. Be honest with what you're feeling, but don't try. And I know that a lot of us do this because we have not been heard. And now if we say we're at level 10 pain, now they're going to hear us. um Bring someone with you, bring someone you trust with you. Like
I
in
always
in
bring my
Jen's
husband
case,
now.
her daughter was her advocate.
Well, after that day, she didn't help me much, but at least, and they didn't listen to her because she was just some 17-year-old. They didn't listen.
Yeah, but
When
sometimes
I
you do.
went to
But
the
I'm talking about when Jen brought her husband
Oh,
along.
yes, yes, yes.
Yeah,
yeah,
yeah.
so when I was going through
Sorry.
all of, getting all of my diagnosis and finally getting a doctor to listen to me, and not telling me, oh, just be more careful. At that point, I literally couldn't be more careful. What do you want me to do? Wrap myself
Yeah.
in bubble wrap and live in a hiding hole for the rest of my life? I can't do that.
Mhm.
There's no way.
Mhm.
Yeah. And Cinderella, yes. Um, there, let me go back to your comment. Um, where you can put a check mark next to most of these symptoms. Same. Absolutely. And I've never actually sat down and looked at a list of fibro um,
We're
symptoms, but yes,
going over
yes,
it
almost
during.
all of them.
Sometimes that's what it
Yeah.
coming on here. Cinderella's been really emotional a lot of this time, and I get it because I've been there. When I finally
Uh-huh.
got a diagnosis, and I finally got, it took me almost 2 years to get a good doctor, and you're just and I went on when I saw the cover of this book we showed earlier with all these symptoms. It was my shoulder doctor that told me he thought I had fibro, but that was March. I still didn't get diagnosed till July. I'd had it a year by then, and I bawled because I saw this diagram and all of this. There was only about 10 symptoms, and I called him up because I knew him from church, and I said, "Oh my God, that's me," and that's what Cinderella's going through right now.
Yeah.
Yeah. And this is
Here's the
why,
funny
Kim,
part.
thank you. I want to thank Kim for doing this because many of us do suffer through this. And like I said, it's a very lonely place to be in. So we're doing, Kim, I appreciate this. Like when I saw this, I said, let me hop on this panel. I appreciate you bringing awareness to it. Hopefully, uh, sorry, I get
It's
distracted
okay,
so easily.
Cinderella.
Hopefully people will see it, think about it, advocate for themselves, bring up these symptoms,
Yeah.
talk about it. Not to the point,
And
not to
honor
just
the
everyday
family and
people.
friends that you have.
Yep,
Mm-hmm.
Honor the
absolutely.
family and friends that
Absolutely.
you have that are telling you that they're having these symptoms. Don't
Mm-hmm.
tell them you think they're a hypochondriac,
Mm-hmm.
Oh,
which
Validation
someone
is one of
actually
the
asked me,
biggest
was I sure I
things.
wasn't a hypochondriac?
Yep.
If you
Yeah.
couldn't
I mean
And
understand,
that would
something
be like
else.
someone like us telling someone it's all in your head. That's pretty much what you're saying to people that we know.
Absolutely.
Again, we know what we're going through. And for you to say
Mhm.
it's all in your head, oh, it's in your head, or go out more, you get distracted, you need a
Mm.
distraction.
Exercise more. You need to move
Oh,
your
we
body.
talked about
Well,
yes.
when
that.
your
We talked
body
about
hurts
that.
so bad, or you're so out of whack that you physically feel like you're
Moving it is
going
the
to
last thing.
fall over, moving is the last thing you want to do because you're scared of hurting yourself.
Mm-hmm.
Been there.
Yep.
Yeah, I was so I was in the middle of an exam, and they bring in the student. Now I was I was at an orthopedic appointment. They bring in the student, and her not knowing my history,
Who do we know that
she
did
tells
that? Sorry, I didn't mean to interrupt you. Just what the psychosomatic illnesses we've been reading about in Scientology.
Yeah.
It's kind of what
Yeah.
brought some of this up.
Yeah.
They think it's
Yeah.
in your head.
Yeah, well, this student not knowing my history, what was the first thing that popped out of her freaking mouth was, if you lose weight, and the doctor, this is exactly what my orthopedic did to her. She's lost over 100 pounds already. And I just sat there and I'm like, there we go. Even the students, lose weight, you'll feel better. At this point, I had already lost 100 pounds. I lost a total of 250 pounds at one point. So for them to tell me lose weight, you'll feel better. And this blank didn't even know my history. She's a student coming out, and the first thing that comes out of her mouth is lose weight. Well, how about you read my chart first before you come in here talking about lose weight?
Or how
Mm-hmm.
about for those people like myself who actually could not lose weight?
Mhm.
I've done damn near every exercise plan, workout plan, private trainers, expensive, um,
I did all of that.
diets, the whole nine yards. And because the IBS was so severe for me, my body and my doctor was shocked when he got my lab work back. He said, your body has been in a state of starvation for so long because of this. That's why you can't lose weight, because anything that your body can grab onto, it is.
Mm-hmm.
And that's why you can't lose weight. It's storing everything.
For me, I don't care about losing the weight so much, but being bedridden, homebound for 13 years, all of my muscle is gone. My lean muscle is gone. You see this right here? This isn't even fat right here. This is just because the skin from the muscle being gone. And I'm like that everywhere. And so I want to go to the gym just to strengthen, just to get my strength back. Because my husband got me a automatic pew pew for a present, and we had to shop for like 2 years to find one I could pull. That I could. If you guys don't know anything, you have to rack the slide. And
Yep.
I'm so weak because he wanted me to, just the other day, he wanted me to try to do it from the front. I had, my fingers and hands are so weak that I couldn't do it.
They're either going to be weak or they're going to be swollen or both, depending on the time of day and the temperature outside, the temperature inside, you name it.
Yep.
Like, I'm lucky if I can wear all of my rings. Oh, yeah. I'm lucky if I can wear all of my rings on one day, because my fingers will individually swell and shrink. It's like anybody outside of this chat room would probably look at me and go, no possible way.
I know.
Yep.
Like right now, I'm sitting here and I'm trying to stretch my shoulder because I'm in pain.
My lower back.
When you were talking about that hyper, what is it that your condition is called, Pup?
Hypermobility.
Yeah, you see, some for me, what they would call double jointed, and it's not nowhere near as aggressive or as bad as yours. But how I've injured most of my injuries, I've never broken a bone except the clavicle here when I was hit by a car crossing the street. I was walking, I got hit by a car. That's the only bone that I have ever fractured. Now, everything else is usually due to ligaments tears, tendon tears, because I am double jointed. I mean, I would lay when I was younger. I would lay on the carpet and just bring my legs all the way over here. And my injuries have been because I have overextended my ligaments. So, like my shoulder, my ankle. I've had my ankle reconstructed, a total knee reconstruction, my shoulder reconstructed. I've had abdominals. You name it, I probably have had the surgery. That's why when I lost all my weight and I qualified for it, and I was told that the insurance company would cover the tummy tuck, I was all like, nah, fuck this shit. I'm not having another surgery if I don't need it. I could be walking around looking all cute without this additional weight down at the belly, but another surgery, no, I was done with surgeries. I need my other knee done, and I'm already triple thinking
Well,
about it. I don't
and
even want to have the back surgery.
something else that I've been kind of looking into is so Kim, yes, child abuse, physical trauma, and surgery. I am a 2-time survivor of childhood SA. By the time I was 10 years old,
They said those are the biggest precursors: is child abuse, cervical injury, and a trauma to your body.
plus my mother has been diagnosed with fibro,
And we talked about it being hereditary. My
and
daughter
my
has it.
grandmother,
I'm pretty sure my
and my
mom did.
grandmother.
I go back, and she was very hard to live with. I had the same issue when I was 17. And when I got out of basic training at 17 and got home, I grew up, and I didn't even go back to her house. I went to live with my grandmother after that. So, but yeah. And I had the cervical injury in a car accident when I was 19. And then
Before I
I was
forget, the
8
reason
in
I
my
got up,
first accident.
yeah, so
the
when you
reason
were
I got
talking,
up,
I was
Pup,
like, yup, yup, yup.
I remember you mentioning your migraines. I went to a migraine specialist here, and when they were doing the trigger point injections, they would first put this spray on me. Now, as you can see, it's a very well used and loved spray. They would put this spray on me, and I noticed that the minute that this spray hit my trigger points, it just like the migraine would just kind of so instead of having 11, 12 injections, she prescribed, and she's a great migraine specialist. She was the dentist that was in a car accident, and after that car accident she started having severe migraines, so she went back to school and now is a dental dash um, migraine specialist. But this is the
I
spray, and it
really
does
meant
need to be prescribed, but this is the spray that just immediately takes away the migraine or the neck pain. So it's just kind of like a little light. And I've showed it to other migraine sufferers, and it's helped them as well. What it does, it's just cold spray, but it's a very fine mist. It's a very fine stream. And this
it.
is what has helped my migraines. So I don't have to take another freaking pill for me. Might be totally
Right.
different for you. It might not work for you, but this is something that I found very much needed. And again, now I don't have to take that, or they would, or I would, and she's the one that told me this. Take 2, 3 Tylenols, or the Tylenols with a Coke, something that has high caffeine, black coffee, and that also helps with the
That is what
migraines.
Excedrin migraine is.
Mm-hmm. Mm-hmm.
And that's
Mm-hmm.
actually what I take for my migraines when they're really bad.
Yeah.
So yeah, no, I'm
Fatigue, prolonged. Oh my God, it's yeah, it's a lot. It's
these
a
are
lot
these
that we
most of
deal
these
with.
are hitting exactly what I go through and what I deal with every day.
Yep. Yeah. And it's not that that we don't change your mindset. It's not always about changing. It is to a certain extent. You know, I would love to be out there 24/7 like I used to be. I used to walk 2 miles in the morning, 2 miles at night. I would like to be able to do that, but right now I have my leg propped. I'm starting to feel the tingling. I'm starting to feel this. You know, it's very difficult for some of us to live everyday life. Um, and so I know that at night when I'm trying to settle in and I'm trying to quiet my brain, uh, a lot of the times I might not be in there chatting, but I'll just listen and watch pups stream, and just to take my mind off of 1,001 things that I have going. Ah, honey.
Yes, Cinderella. And a lot of us that have experienced traumatic events, trauma of our own, a lot of us, we just keep going. You do because you
Yeah.
have to, because it has to get done.
My mom was one of them. My mom lost 4 kids, and she would just keep going, keep going, keep going. And it wasn't until my oldest brother was murdered, um, that one nearly took her out. And yeah, I mean, going in at 10, 11 years old and finding your mother whipping herself with those army belts
Mm-hmm.
because she thought it was her fault. Having seen her uh, naked whipping herself with this big old belt, because that was her way of punishing herself. That was, as you can imagine, very traumatic. Um, but let me tell you what I enjoy about this community in general is that we seem to have a lot of empathy for people. Most of it because we've been there,
Oh, yeah.
done that. We've gone through some type of trauma, maybe not the exact same trauma, but we have all experienced it, and we're still able to be human. We're still
Yes.
able to sympathize. We're still able to say it's going to be okay. We're going to be fine. You're going to be fine because we're going to be here to help you be okay. That's something that I have really my therapist couldn't understand why I don't just close out YouTube and your problem is gone. Yeah, to some extent,
Oh my
but
goodness.
when you're home, I then for years after I had to drive. Oh my God, baby girl.
That's
Oh
re-stimulated
no.
trauma.
Yeah, like
So,
I said, I grew up in an area where, your childhood friend is now in the middle of the street because he has 3 bullets in his back. Um it's yeah. Um I can't even imagine. I don't want to imagine. I saw it with my own mother. How losing a child can. I just that's something that I will never understand to right now. But
I'm going to mute myself for 1 second.
just seeing what my mother went through, just seeing her pain, Cinderella. And we forget about the fathers too. A lot of the times the fathers also go through this, so it's not just women. Um, I'm so sorry, Cinderella. I
mm-hmm,
am so sorry.
mm-hmm.
Yeah, it's a constant. It's a constant. I'm hyper vigilant. I'm always making sure that there's no one behind me. Um, where's the exit? And I don't say this aloud, but it's always okay. Where's the exit? Where is this? I used to just thought I was prepared. I didn't know it was called being hyper vigilant. And you're always in that. How am I gonna escape this if I have to? Oh, Susie. Hi, Sushi. How are you, Susie? Sorry, guys. Let me see some of
So I'm
these.
gonna, since we're getting a little, I wanted to talk about how I got
Mm-hmm.
myself out of bed the first time.
Mm-hmm.
So and really brought down a lot of my symptoms. So what I found out, I was on vacation at the only vacation we've ever taken, because every time Tom got leave in the army, we went back home to see family. We never did real vacations. So it was 2013, and we went to South Padre Island for a few days. And it was the last day, and I was in this little boutique. This lady would make necklaces for you. And this woman, I had my cane. I was really feeling bad that day. I thought I was just worn out from the vacation. To be honest, I spent a lot of time on the couch when they were all at the beach because, I was still pretty bad then. Well, she says, "Can I ask what's wrong with you?" And I said, and I told her, and she said, "Well, we have a low pressure system coming in. That's probably why you're feeling worse." Never knew the barometer could affect me. Didn't understand when people said my knee hurts when it rains. So after that, I have an old barometer that was my dad's hanging around here somewhere, but I check it on my phone now. So she was a chiropractic / nutritionist. And the girl behind the desk, she had listened to her too. She was like, "Yep, yep, yep." So she told me, gluten causes inflammation. So no matter what, it definitely affects autoimmune diseases like rheumatoid arthritis, lupus, fibromyalgia, and then any other pains you might have. And she said to go off gluten and dairy. I couldn't do both, but I don't eat a lot of dairy. It's mostly just cheese. And she said go to greens, fresh produce, and stuff. So through the years, so I didn't take her advice right away. Now this was 2013, and I live a good hour from the border of Austin. Between there and here, there's nothing. So if the local stores don't carry it, I had to go all the way to Austin when I finally decided to go gluten free. I had to go to Austin once a month and get all the gluten free stuff, the pasta and all that. And I had tried some other things before that. So I finally did it, I think it was even a year or so after I talked to her. And as soon as I cut out the gluten, I stopped eating processed foods. I went to fresh or frozen produce, organic when I could afford it, because, and I literally started sleeping better. I had more energy. My tremors got better. Other symptoms got better. I was able to get out of bed and start being normal in the house. I still couldn't go out much. I didn't like to go by myself because of my unsteadiness and stuff. And my fibro affects my throat muscles, surprisingly, but mainly when I get stressed, which I'm not usually stressed when I'm protesting. So that was a big turning point for me, other than, medical stuff. The other thing people have been here talking about is acupuncture. So years and years, this doctor I found in 2012, we started doing trigger point injections from the base of my skull, out my shoulders, my whole upper back, down the inside of my shoulder blade. Now, he'd never done as many as he did with me. Most people get 3 or 4. But I was so tense from the fibro and the fight or flight and he would literally bring people in to watch, because you could watch my muscles jump when the knots would release. Now, he tried different steroids, he tried Botox, and none of that stuff worked. We only use lidocaine. So it's literally like acupuncture. It's just the fact of the needle going into my muscle, releasing all that tension. So anybody that thinks acupuncture might be a way to go, it will probably work. That's just my own opinion because of what I have. My hair loss, no. Well, maybe. I started to thin right here. That's why I had to start my bangs way back here. Right through here. My hair loss actually more started when I had the gastric bypass. Did you have that problem? Because it shocks
I
your
had it to
system.
some extent, but
Yeah.
if you notice, I have, once I got on the vitamins D's
Right.
and the C's and that, my hair started growing. But I also had issues with my thyroid.
Mhm.
sorry. Once I lost all the weight, believe it or not, they took me off the thyroid medication. I was on thyroid, but it was weight related, where I was so obese that my thyroid wasn't functioning correctly. So when I lost all the weight, something they told me wasn't going to be affected
Biotin.
actually improved.
Hmm. I honestly
Biotin,
haven't
yeah, biotin.
tried a lot, but it hasn't gotten worse. So I think it probably did stop it. But it was mainly I looked like I had Parkinson's disease for the first 2 or 3 years. I mean, I tried still going to church at first every once in a while, but I would have to lean against the wall. I find a seat by the wall because I was doing this. I thought I had Parkinson's, but they ruled that out. So I just wanted to bring up the oh yeah, that's true. Um but I forget where I was going to go with that. As far as meds go, I think everybody, I'll be honest, a lot of the ones they gave me at first, I have since gone off of. And actually, one of them, my symptoms got better when I went off. The only stuff I'm still on and have been on since 2012 is the tramadol, the Celebrex, which is an anti-inflammatory, the Flexero, which is a muscle relaxer. I think that, and then I tried to go off Lyrica recently because that's what caused a lot more weight gain. Because I fought him for years to go on it because I'd had a side effect before I got the Fibro with it, and I went. So just like a month or two ago, I tried to go off it, and I weaned myself down off of the Lyrica over several weeks. And so I
How
was
do you
off
feel
of it.
off of it?
I'm back on. That's what I'm getting at.
Okay.
So, when I felt okay, it was mainly I was hoping my brain, because it affects your brain. I was hoping it would help my brain more than anything. I didn't even care about the weight that much. So I was the first week was horrible. Every time I tried to sleep, I was the jerks and the shocks were back way bad. I did that for about a week and a half, and so I was like, I gave up and I started taking one at night, and it got better. And then I had a follow up recently. We dropped it to 75, and we're going to try to drop me to 50 at night, just one. So, and also, we were talking about IBS in our stomachs. So I finally, I never really talked about my digestion issues with my pain clinic. I didn't see the relevance. But then when I did, there's an opioid, when you're taking opioids, you can get constipated. And so they put me on this Movantic. It's for opioid constipation. I've been on that. I've been taking the the fiber powder in your drink. And it's gotten tons better. And so I didn't even think to talk to my pain doctor about this, and I'm glad I finally did. I've only been on this a few months. And then the rest is all you guys are talking about, vitamins and supplements. So, let me get into this. So, in my research, and I've always been health conscious and conscientious of the environment. So I was already doing different things before. I have this thought that fibro might have something to do with the toxins in our environment. So I have over the years gotten rid of all my plastic. I only use glass or stoneware in the microwave. I definitely don't use plastic in the microwave. I think it releases more stuff. I just went to mason jars for like my canisters. They were super cheap. And they're expensive, so I only buy like one a month here, or every few months. The silicone bags, so I'm not using the single-use bags, although I still do when I don't have that many. So I've tried to eliminate. We only use vinegar or natural orange cleaner in the house. So maybe that all together has really helped a lot of my. I was doing a lot better, and then 6 years ago I hurt my back. So the last 6 years I was bedridden wasn't due to the fibro as much as it was to my back. So, everybody's different, but that was just my thought. And I did it over years. I couldn't afford to do it all at once either. So what I do, and then my supplements, I'm on a lot to make it fit in. So half of this is prescription, half of this is supplement. So instead of trying, I have all the bottles in a big tote in the hallway. I keep them in baggies. So I have a little box in here with all my supplements, my B12. I take a lot. Oh, by the way, we're talking about sleep. I found out taking magnesium at night really helps. I take the B12. Like, of course, I had to start the B12, and you may have had to also after the gastric bypass. I don't know if they recommended
Actually,
it.
I had excess amount of B12, so
Really?
I don't do the, yeah, I don't. You see, I was able to maintain my weight for all these years. I want to say I've been 14 years when I had the gastric. I was able to maintain. I turned it on.
That's okay,
Oh.
Lily. You can go back and watch it on 1.5.
So vitamin B12, I'm good on. It was the vitamin D, the vitamin C, and the iron that I have an issue with. But I was gonna say something about and of course I forgot.
That's a good idea.
Oh, collagen in your coffee. Does it make it taste weird? Kim, if you can say some, and I know that it's a combination of everything that you've tried now. What's the one thing that you can definitely say, you know what, this is what made me get up?
Going gluten-free. Because when I cheat and I eat gluten, I feel it. I have a flare. I feel more pain, some symptoms. It depends on how much, because I'm not allergic to it like celiac disease. So I'll cheat sometimes and have thin crust pizza with my husband or something, and I know I'm going to pay for it. That's how, when I know, the way I find out when something works is when I stop doing it, or I'm out of something, or I cheat like that. And there have been times like I'll go get a burger at Burger King or something and have a little bit of bread, and I'll feel it. So I would say
mine
that
are my allergies. I know that when I don't take my allergy meds. And when I first went to the rheumatoid arthritis doctor,
yeah,
the rheumatologist, you know what I mean.
It's hard to say.
And I brought up that when my allergies flare up, I feel everything just hurts more. He thought I was crazy. And now they're doing studies. There actually wasn't a study on that. Now they're doing studies on how your allergies affect the rest of your joints, because you can only imagine if your sinuses are swollen, or you're having sinuses issue, or allergies causes you to swell up, what is it going to do to the rest of your body? You see, I get welts in my face when I have an allergy flare up. I'm highly allergic to mold, and anything in the refrigerator, a tomato, whatever, can set it off. But I'm going to get off so that you can.
Right.
I see that Pup and Scooter Mom are gone, so I'm gonna get off.
We did this a lot longer than I expected. Thank you for I didn't get to really tell them all thank you for coming. This was awesome. I think we learned a lot.
Well, I'm hoping you will host another one so that
I think I will.
Yeah, I think this is important, and we can do maybe another subject, and you let me know how I can help, and I'll be more than happy to come in.
Okay.
Look at all these.
Yeah, you said things I didn't even think about.
Issues.
With the patient advocacy.
Yeah. But anyways, thanks you guys for allowing me to come on here, and I'm gonna go to chat now. Let me go and chat with these people. Thank you so much, Kim. I really do appreciate you. Thank you.
Well, I'm glad even if we only helped one person, that's my goal always. And when I do talk to people about my history, the biggest thing that I do talk to people, I try to get the diet thing out as much as possible to everybody, because when I finally did it, and the huge difference that it made, it was a significant, I mean, so many of my symptoms either disappeared or got better. I started finally sleeping better. I still don't sleep that great. I had more energy, and I was in my bedroom all the time, and I was able to come out of the bedroom. I was able to cook dinner, do a little more things. And that's okay, hon. That's okay. Like I said, we're gonna do this again. Maybe I can get some other channels to promote it next time, so we can get to more eyeballs. Oh, thank you. Well, that's why I did it, because I talk about my history medically, because I just do. But the biggest thing I always bring up is, when I don't talk about the whole thing, I'll just say, well, if I hadn't been bedridden, I wouldn't have seen the anti-Scientology content and had the time to deep dive into it for a whole year. And then if they hadn't have put the back stimulator in my back, it literally healed up in January, and they opened the org in February, and I was able to protest. Had those things not happened, we wouldn't be here right now. So I always feel, even when it's bad, sometimes it happens for a reason. Yeah, we're talking about doing the autism awareness too, for sure. Yeah, I didn't really promote it. I had thought about emailing a few of the other bigger channels and having them maybe mention it, and I didn't. So, anyway, what I was getting at is, so many people through this last year have talked about, oh, I have that too. Oh, what worked for you? Oh, this, just, I've had so many people comment. And then there were some other people I wanted to come on today that are creators, but I guess they couldn't make it. And so hopefully they'll be with us next time. Like Farrell Cheryl, I know I've talked to her about it before, because she's had those shots and mentioned that they helped. But yeah, so my year anniversary is actually today. I moved the balloons over there, but because we were doing this, I celebrated it last night at midnight. We lit the candle at midnight, since it was the 23rd of the day I went live. I think I protested about 4 days before that, till I figured out how to go live. But yeah, Cinderella, my email is always on my channel. And if you want, I got an extra line for my live streaming, so I could have a separate phone, because my flip phone overheats and I got tired of it. I'm willing to give this number out, because I know it's only going to be SBTV content, and if somebody tries to spam it, I'll just ignore it. So if you email me and you want this number, I'll give it to you. You can text me, call me, whatever. So I'll put my email here if you want it. So I'm willing to talk to any, I don't have a problem talking. What's funny is I hate talking on the phone. And that started when I got sick, because that was my job. It was part of my job. When I went in the hospital, they told me it was a social anxiety, because when I get stressed, my throat muscles start to spasm and I talk funny. I don't even like to make doctor phone calls. I make my husband do it. So there's a lot of social anxiety there about talking on the phone, but this is so much easier. And, I used to hate texting years ago. I hated it. Now I like it, because you get to talk to each other and you don't have to sit right there and answer immediately, which I like. Group hug. Yes, group hug for sure. really good insights from everybody here today. When you lose the will to move, you will die. So me and Scooter Mom did a 7-hour one night, and most of that time was just us. And we talked about a few things. And one of those was I've had people say to me, you don't look like you need a cane. Because when I use my cane, I walk really fast. And I've done that my whole life. But the reason is, early on when I was very weak, I literally many times, especially with the walker, I would be shuffling and walking so slow I came to a stop. And so that's physically, but yeah, both of that. And so if you've ever ridden a motorcycle or a bicycle, the faster you go, the straighter you can go. And I'm very unsteady. I had to stop riding my motorcycle when I got fibro. So I walk fast because the cane is only for balance. If my legs are going to give out, that cane is not going to do any good for me. And it's happened. My legs have it's like I get this switch shut off real fast. Literally, my eyes go dark, my ears stop hearing, and my whole body drop. But it's so fast that it's instinct that as soon as that happens, I tense up and it comes right back. It's like somebody switched the switch off like that. And there have been times my legs gave out and there's nothing I can do about it. Yeah, exactly. Yeah. Well, a doctor did this to me. If you go back and watch the beginning, the quick version is a doctor messed up my meds and it shocked my central nervous system, and I got fibromyalgia overnight. It's called traumatic fibromyalgia due to that trauma to my system. And so then I had pain management doctors that sucked. And I was lucky I found a good one, and I had him until a couple years ago, and he disappeared from the office, and all they told us was he had a family emergency and he was gone. And for him, he was so good with his patients. It had to be something major, and I never did find out why. I think I found him, and he's at somewhere doing anesthesia. I think he got out of pain management altogether. I think he needed what it was is this clinic I'm with has opened so many clinics all over Texas that there were weeks he was flying to other cities to work at these clinics. I personally think he was overworked. But I don't know. It's just me. I have older phones I can do that with. But yeah, so, and then the other thing, like you said, if we don't keep moving forward, and that's what the protesting has been for me. There are days it's hard. Like right now, my back is screaming. Sitting on this chase is killing my back. I'm trying to get my craft room cleaned up. It's got 6 years of dust all over everything. I've not been in there since I hurt my back. It's bad. I went in there thinking I could just wipe everything down and dust. It's going to need an intensive clean. And so this is the only place I can, other than my bed, where it would shake. So just sitting here, that's why Mondays I never protest, because between my Saturday night, we did 4.5 hours. Today we just did 3.5 hours. I'm recuperating on Monday. Oh gosh, I know. I didn't actually whack him. It looked like I did, but between me and him was my wagon. Adam called it my wagon of justice. I had made a fort around me, my wagon, the bench, my tripod, and a tree. So my sign was sitting there, and I whacked the sign to let him know I meant business. And it looked like I hit him with it. So, oh, that's cool. I'm glad you've been around. I'm surprised at how many lurkers I have. It's cool. I like it. Like I said, You guys make it easy. You guys make it easy to go down there and stand there some days without anybody stopping to talk. That's what makes, because I know being on my end, I go and I support other protesters or channels, and yeah, it can be kind of boring a little bit, but I'll just let it play those days, you know, when I'm not always in the chat, just to give them the love, to support them. And you guys are so helpful with that. And last night, you should watch last night. I played clips. I played the clip of that guy. I played the big clips. You can always fast forward to the certain. I'm gonna pull those things out and make them standalone videos if you don't want to. Oh, thank you, Cinderella. And well, I always wanted to be a teacher, and so when I learn stuff, I want to tell people. If I learn a trick or a life hack that I think works, I want to tell people. I found out that the new diet worked. I wanted to tell the whole world, stop using gluten. Thanks, Grandma. So that's just, and so I find out about Scientology. I've never been an activist sort of person. My life has been pretty boring for the most part, just being an army wife and doing my thing. And when hubby retired, and 2 months later I got sick, and this was supposed to be our golden years or whatever, and because I lost my job, he's still having to work too, and that wasn't supposed to be the way it was supposed to be. He's already done 20 years in the army. Now he's been doing 14 years in security. Yeah, that's what I should do. I'll try to do that. I'm trying to get better at this YouTube stuff. It should be. I hope. If it's not, let me know. I didn't not put it on replay. I just recently learned that watching on a computer, I can see an old replay. So now I wanted to talk about that too. I didn't get to. When I was showing the symptoms of the brain, so that was that's the worst part of fibro, is the fibro fog and the fatigue. The fibro fog, going from somebody that can multitask 4 things and read a novel a week, a big, thick novel a week, to not being able to concentrate on a magazine article. So my mother-in-law, she's passed away since then, but she had early Alzheimer's, and we were comparing symptoms, and I sounded exactly like her. And that has really wigged me out ever since. So I've really done a deep dive into dementia and Alzheimer's, and I've tried to do things. I do a lot of brain games. See, for the first many, many years, I just laid in bed and binge watched TV. That's all I could do. And so when I finally started getting into the YouTube stuff and getting more interested, and I tried it, and I found out high sugar, high glycemic levels can be a precursor to dementia. Something I read about, but I'm lucky there. I've never been a big sugar person. So I use coconut sugar, which has a low glycemic index, coconut nectar or blossom sugar, not palm. And I've switched to honey in my coffee, hot coffee, a long time ago. Yeah, we did have quite a bit of things that we talked about that were really great. We're gonna do it again, Janet, because we only got I had under 20 people the whole time. I know there's more out there that could get more from this. And so I would like to do it again and maybe promote it more, maybe a longer time out. And because when I talk about it on my streams or in other chats, sometimes we get to talking about it. There's so many people in the same boat as us. Oh, wow. Now that I hadn't heard about. I will check on that. And see, I learned some things today too. I didn't know about the iron infusions. I just don't take iron, and I get what little's in my multivitamin. And to show you how much, oh, sorry, I can't do it. See, even though I had the pain stimulator put in my back, the discs are still injured. So it only takes care of a certain level of the pain. Oh, I tried it. When I got straight, it's like, oh, it's painful. Oh, it's a nickname. Oh. Okay. I'm still gonna, I'm sure Google will tell me. But seeing what you were saying, Cinderella, and going, oh my gosh, this sounds like me, or giving you the terms to tell your doctor, that's what made this worth it, because I knew I flailed. I was alone. We're military, and we just stayed here. He got stationed here for 17 years, retired. Our daughter was still in high school. We had the house, so we stayed. I've not had any friends since my 20s. If you go back a few days, I did a stream on my toxic friend and what happened. That's why I don't have friends. And we haven't lived near our family since we were 20, when we got married and I moved where he was stationed. So, and I've been kind of I never got involved in those wives clubs and family stuff on base, because, especially after the chick in my 20s, because some army wives be crazy. You get you get this thing on TV where you think everybody's a certain way. No, you get all kinds. For real. Well, I brought up that list of symptoms. I haven't looked at a list of symptoms in many years. I just knew there was 200 symptoms at the time. That was more than 200. And I had or currently had 80% of them. Now, holy crap, I think that was more than 200. And I hope I'm going to go back and try to put the links to the books and that list in the description or comments or something. Yes, I was. You do? Yes, I was. I remember, and I cannot remember who that was. That's why it's so near and dear to my heart. When people try to say SBTV is dead, we need to change the name. I don't want to. But that's just me. I'm biased. If a whole bunch of people decided they wanted to change it, I would be fine. But I'm like, when it was given a name, that's when I saw people coalesce around it and really feel motivated in it and really get more involved. When you have a name, yeah, for real. Yeah, because I can never remember who that was. I know I could probably go back and find that chat, but I don't want to. So, but yeah, so, and it tells me what my analytics are on my channel, and pretty much my analytics are, I think, 35 and up. I literally have nobody listed under 35. But they're more my age group. So I know a lot of people out there have chronic pain at the very least. Then on top of that, a bunch of other stuff. Well, I did if you watch, I did a short video. I've since changed my mind, though. I was trying to stay out of it, trying not to have an opinion, but I kind of changed my stance a little bit on that, because when Eric finally said we need to get back to protesting the way we used to and not putting up with the BS, I'm all for that. Because there's just people involved that don't have any good in their hearts. There just isn't. Or they've been misled. Oh, no! Did you DVR it? Yeah, I thought you were going to leave early because of your basketball game. Oh, no. But yeah, let me look at my analytics again real quick. Gotta get new. I'm going to the eye doctor tomorrow, Scooter Mom. And I'm out of my blood pressure meds too. I gotta call the doctor. See, they made us, when and when I think it was Obamacare that did it, I had off-post doctors even in the Army, and they made us as retirees go back, and now we have to go to the hospital, the clinic in the hospital on base. I'm just like, and the first 2 times I went, I left in tears. I'm 40 something years old with a walker, and she didn't even care why. I'm trying to talk to her, and they literally will give you 15 minutes for your whole thing. Well, all of that was taken with my history because it was my first appointment. I'm like, they should treat retirees different. We should get more time because we're older and we have a lot of crap wrong with us. My husband's 80% disabled. I'm 100%. Yeah. Yeah, I knew. Well, like I said, if we can only help a couple people, it was worth it. I understand, Anna. If you could email it to me, I'd just like to know for personal reference. I'll put my email in again. Holy crap. I was trying to go to YouTube Studio. Here we go. Lost some subscribers again. What's fun? I do lose subscribers when I don't protest, and I went a whole week. It's like, oh, she's not protesting, we're gone. Or I made a mad. You know, I need to put it on my community tab. If you're gonna unsubscribe, tell me why. So if it's something I can do better, I'd like to know. Analytics, here we go. Let's see. Where's the age group? Audience. Here we go. I don't do this a lot. Age. Oh, I didn't have any of this before. 25 to 34, I've got 5.2%. It's probably one person. Okay, 35 to 44, 17%. 45 to 54, 19%. 55 to 64, 34%. And 65 plus 22. So pretty much 35 and up. Big one there. I'm going to be 56 next month. So my age group is the biggest group. So I kind of, know that and knew that, many of you would probably benefit from something somebody said. Oh, especially Puck Groomer. I'm glad she came on because that ProLabs thing has got me ready to. I need to see. I want to make sure that they check me for that. It's just something you wouldn't think of, Before I go, here's a list. I do take a long time to say bye. It's because honestly, when I'm not on here, my life is boring. I'm trying to get back into my craft room, back into my creative parts. But usually I'm sick because my husband sleeps all day. Hey, Eric. Yeah, we're still here. We had a lot to talk about. But usually my husband has slept through mortar attacks for many years. So I can literally sit on the bed next to him playing a show and he doesn't even notice. Literally this far from him. So I'm usually in there. It's because it's more comfortable. So even though I'm not bedridden anymore, I'm in my room a lot. Just because. Yes. Oh, I'm glad you're still here. Yes. It's something it's not on our mind, at our age. And I have had a lot of weird cramps. And there's another faulty thinking. First, I had doctors tell me, don't try to figure out why you have all these symptoms. You have fibromyalgia and you can't explain it. But on the other side, what worries me is, am I attributing a symptom to fibro that could be something else? And I do worry about that. And so I have a lot of cramps the last few years, and it does worry me, even though it could be fibro. So it doesn't hurt to check. But I had the same issue you did, Pup. So for a while I was going all the way to Austin to a pain management clinic because I thought we only had 2 doctors at the time, and I'd gone to one, and it was not a good fit. And I thought going to Austin I'd get a better choice, and I literally, if I had an 8 a.m. appointment, I had to leave at 5 a.m. because of traffic. And I did that for a while, and I would leave. I was still working. This was after my shoulder injury, and I would miss a whole day of work, and they were getting on me about it. So I finally switched, and it took me a year. I switched to the hospital, the off-post hospital, but it took a year to get me, or no, I can't remember my dang timeline. Anyway, it didn't help me. Yeah. Yeah. Getting close. Not quite there yet. Well, I do think about, wow, we'll have to figure out what that might be. Oh, you said something. Yes. Especially if you don't have a woman doctor at some point. I just had a thought. It went right out of my brain. Fibro. Drives me crazy. I get so frustrated, I literally give myself a headache right here, trying to think hard. And I don't get the migraines, but I get the tension headaches. That's another reason I get those trigger point injections. I was telling people, let me see, I'll show you. Because my doctor, I've got a new doctor who's listening to me in the same office after my other doctor left. See if I can find it. I wanted to show you. So my husband marks me before I go. And it looks like somebody wrote football plays on me so that the doc knows where my worst spots are. It's probably going to be hard to finish, so I'll keep talking. I may not even find it. I have way too many pictures in here. Go away. But that's why if the trigger points are helping me the way they do, I think acupuncture would do the same thing. And it releases the knots that your muscles. Oh, and that's another thing, that the reason you have all this pain is because my original injury is my neck. Your body wants to protect you from the pain. So your body tenses up around that pain, and that's what causes the knots, kind of radiating out from whatever you got going on. And that was another thing that they explained. Like, oh, it made sense. I don't know how long. It might not even be in here. I have my phone's upload to Google Photos so I can save stuff in case I lose my phone. I don't know how long ago. Oh, there it is. Found it. So this is what I look like when I go to the doctor. So the round circles are the really bad spots, and it goes all the way down to the bottom of my shoulder and all the way out my shoulder. You can't see it. Anyway, and all those dots get an injection usually. He's not maybe every one. He may space it farther than I do. Yes. That doesn't, I don't even understand that. This should be an automatic biopsy immediately because 6 months can change a lot. That too, when you're in chronic pain, it overwhelms your whole life. And I have put a lot of things off, put them on the back burner because this other stuff is taking up so much of my life that that's what happens also when you have chronic pain, and when it, it's your whole focus. And so many other things don't get taken care of. Yeah. Oh, and since you're, I don't know if Eric Rader's still here, but somebody asked, or mentioned, people in Scientology that have chronic pain can't do anything about it, because one, they either have to, oh, you're still here, because they were like, what do people do in Scientology when they have chronic pain? Because they're taught it's psychosomatic. I guess they get, more auditing. But I asked Nora a long time ago. I said, how did you tell yourself, because she needs glasses, how did you rationalize needing glasses with going clear? And she said, I didn't wear my glasses for 4 years. I'm like, but you still can't see. So I get that a lot of people probably talk themselves out of some things that they have to deal with. So I do worry about those people, and I see those older, stooped people, and the fact that they don't get any medical care, it's just sad to me. It really is. So, well, I'm going to go. My back is screaming at me. I'm going to go lay down myself and put a lidocaine patch on. Not that they work that great, but it's better than nothing. So, we're going to be, April is Autism Awareness Month, and we're going to do something on that too. And like I said, maybe in a month or so, I don't know when, but we may do this again with a little bit more promotion. We can get some more people in here that might benefit from what I've had to go through. But if not, till then, I'll see you guys in the chats. Have a good week.